being beaten up. And people in the elite group here, whether from IAS or police or army or anywhere else, they may be on top. As there was one SDM fellow, he says, and people say that कि बाहर तो लोग सलाम करते, घर में दो कौड़ी की औकात नहीं. So this is not normal, and that is what we tell the family members. ये normal है? Is this normal? हम लोग जो जनरल अभी हमने बातें की, हु इज अ एनपीडी, वो एक बिहेवियरल पैटर्न्स है, उससे उतना प्रॉब्लम फैमिली मेंबर्स को नहीं आएगा, पर जनरेशनल एंड टीम मेंबर्स इज टॉकिंग अबाउट इंटरजेनरेशनल ट्रॉमा. और जब कपल काउंसलिंग में केसेस आते हैं, व्हेन दे टॉक अबाउट सम ऑफ द इश्यूज दे आर गोइंग थ्रू, तो वो दादाजी और परदादा के टाइम के बिहेवियरल पैटर्न्स दे आर बीइंग कॉपीड इन द फोर्थ जनरेशन. So so-called I always tell them, अपनी शादी बचा ली, clapping. बहुत अच्छा किया, बहुत सहन शक्ति आपने करी. Be prepared for your children's unhappiness, and you are responsible. You will be responsible because you were the non-NPD. बट खैर बहुत सारे डीपर इश्यूज होते हैं. एंड अमिता मैम ऑल्सो नोज कि हम एनपीडी में कितना कितना काम करते हैं, बहुत डीपर. एंड we have been working together since a long time now, on especially on this. I think hum log connect be on this subject because so many people, they start connecting and they want to know, do something. I was talking to another colleague and he was saying that most of the patients come and say do something, और उसके basis पे then we came up with some of our PhD students are doing pioneer work. And that is what I was telling Dr. Vikas, that we have to go beyond only the textbook aspect of theoretical aspect of psychology. जो हमारा PhD वर्क में लोगों को फायदा मिले, वो थेरेपिस्ट जिससे एक्चुअली फायदा मिले, and they can be measurable, is not only in terms of statistical measurement but in terms of actual behavioral improvement which the people are talking about in over sustained period of time. And this is what we have been doing at least for the last 10 years. इस पे बहुत वर्क हुआ है. And hence the book came out, Navigating Narcissism, which is the only book in the country for on Indian subjects about Indian issues. And people say कि हमें मिलता नहीं है, we don't, yeah. And all of pioneers, and as I said, therapy is a power of three. That is another book, which is therapy, hypnotherapy, and subconscious energy healing therapy. We call it Sehat. And Khushvinder sir is here. He is heading the well-being cell of Triple IT. And because of him, we have been able to, in the library also, all these books are available. They are pioneer books in the country, even abroad also, because people from various across the borders also, they keep asking, वो लिंक भेज दो, we want to know and read more about this. अभी सर ने कल इटली में भी किसी को एक one of his patient, he has shared the link. Okay, so yeah, so they need constant praise and validation. ये भी बहुत ज़्यादा होते हैं. Yes, next. Okay, so narcissist ka checklist, these are also you can read, but basically red flags. Abhi yesterday only we got a case from Delhi, GK. So the parents came along with the girl, 5 years of marriage, because ye youths hai, basically youngsters hai, aapke friends also may be going through this kind of abuse, or you know about, or you have heard about something. 5 years of dating, 2 years of marriage, and the girl says, I give up. And her father, who is a lawyer, they are saying कि reconciliation अगर हो जाए तो, कुछ हो जाए तो, something. And they came all the way because eventually, as part of family therapy, is very, very important. We talk to the family members because ये problem NPD, many times people come and say, आप बोल दो legal issues में भी कि शादी के बाद problem हुई, mother in law ने ऐसे बोला, father in law ने ऐसे बोला, husband ने ऐसे किया, but शादी के बाद हो ही नहीं सकता because NPD का जो beginning है, and as others will also be sharing, right from the childhood the roots start developing. And by the time you are 15 or 16 years of age, the issue gets manifested. The problem gets manifested, and the family members are the first to know that something is wrong. It starts with generally ODD, opposition defiant disorder, and then grows up into CDs and conduct disorders, and then borderline personalities, and एकदम से एनपीडी नार्सिस्टिक पर्सनालिटी डिसऑर्डर्स. लेकिन वो पूत के पांव पालने में दिख जाते हैं. तो सीडी से शुरू होके ऊपर, सीडी से ही कंडक्ट डिसऑर्डर्स में ही व्हेन वी डू फैमिली थेरेपी एंड वी डू असेसमेंट्स वी कैन कम टू नो. So numbers and the test and the assessment, they tell a complete story. Numbers tell a complete story. सिर्फ देखने की नजर होनी चाहिए, पढ़ने की नजर होनी चाहिए, सुनी आंखों को समझने की नजर होनी चाहिए. Okay, so most commonly in females, but 60% females have it, most and 40% males have it. This kind of issues, and then what happens? Many times वो जैसे ये मैं अभी दिल्ली वाला केस कल का बता रही थी. So closure नहीं मिलता. If you think you're going to get closure, why this person was misbehaving and was abusive, there are two different things. Anger और abuse में बहुत फर्क होता है. We need to understand that, all in the name of maybe Indian culture, or maybe Badappan, I am the bigger person in the relationship. So we keep nurturing even the abuse subconsciously. जो थेरेपीज इसीलिए सेहत सबकॉन्शियस एनर्जी हीलिंग थेरेपी, क्योंकि हमने ही अब्यूज को नर्चर किया था. अब ये केस में व्हेन वो जो बोल रहे हैं कि इतना गंदे गंदे वर्ड वो बोलते हैं, द गर्ल इज क्राइंग, गर्ल इज अ प्रोफेशनल herself, and then she's in this particular this yesterday's case I'm talking about, she's a professional herself, and then she was saying that there are so many things which abuse which she faced that time. And मैंने फर्स्ट टाइम जब उसने गाली दी थी तभी आना था ना, तभी बोलना था ना. बिकॉज वो जो गाने की लाइन है, शायद उनका आखिरी हो ये सितम, हर सितम ये सोच के हम सह गए. And many times 40 years of relationship of marriage, and then people coming up and calling, I didn't realize this was abuse. आपका वीडियो देखा तो पता लगा, समझ में आया. 30 years, and you know, you're aware about all of these because you also face this. Listen to all of this. Okay. And then मैंने विकास सर का एग्जाम्पल दिया because he is a very senior person but a very simple and humble person, but even he could be one. तो पता नहीं चलता कहाँ से, क्योंकि abusers are able to fool outside the home. Now in this case, वो जो लड़की का जो husband था, son-in-law, first year of marriage, he was abusive to parents. He had blocked parents' number, in-laws' number. And second year of marriage, once the girl started withdrawing, he was becoming kind of hero to the parents, mother, the wife's parents, and now parents are very happy. ये तो बहुत हमसे अच्छी तरह से शाहरुख खान स्टाइल में बात करता है, मतलब बहुत अच्छा, बहुत पैम्पर, बहुत सेंसिटिव है. सो इनसाइड द होम जो हो रहा है, और मैंने उनको ये पूछा, मैंने कहा आपका बच्चा रो रहा है ना, आपके सामने वो लड़का तो हंस के बात कर रहा है, आपके साथ बहुत सॉफ्ट है, पर लड़की तो रो रही है ना, आपकी लड़की तो कंप्लेन कर रही है ना कि वो गाली देता है, वो ऐसे करता है, वो वायलेंट हो जाता है. एंड फिर उसने कुछ रिकॉर्डिंग सुनाई. मैंने कहा ओके, कहती आई कांट लिसन इन फ्रंट ऑफ पेरेंट्स. मैंने कहा नहीं, यू सिट एंड लेट्स लिसन कंप्लीटली. एंड वन एंड और मैंने फादर को भी ये बोला, मैंने कहा यू एंड मी आर सिटिंग, सपोजिंग माय टीम वाज नॉट देयर, योर वाइफ वाज नॉट देयर, और मैं 5 मिनट्स में बाहर आ जाऊं, मैं बोलूं इस बंदे ने मेरे को कुछ इनअप्रोप्रिएट बोला, and I can get away with all of this. This is what happens because the you twist the truth. You take two truths and you twist and make a completely different narrative. So in confrontational therapy is something which we're doing all the time, and my team members for 1 hour, 2 hours, and they listen because they also are in the other room or something. Confrontational therapy works beautifully. And many times people come and say CBT नहीं होगा, नहीं होता इसमें. Of course, we can start with that, with the other aspects, but 90% then it has to be case to case different, and subconscious energy healing therapy works. Then children of narcissistic mothers, father भी होते हैं, so उनका self esteem सारा कुछ लो, बहुत ज़्यादा. कल मैंने night में around 10 o'clock I was showing you the report. So my team members were there. So I did past life regression. Again, उनका भी यही issues थे कि mother was very, very डोमिनेटिंग, और वो 40-year-old फेलो ही सेइंग कि आई फील वर्थलेस। और इश्यू क्या था कि लोग पता नहीं 4 करोड़ कैसे वो करते हैं। सो ही वाज सेइंग लोग पता नहीं 4 करोड़ महीने में कैसे कमा लेते हैं, मुझे तो 1 करोड़ में उसमें ही प्रॉब्लम पड़ती है। लाइक प्रॉब्लम एरियाज है, बट उसका बिकॉज ऑफ दैट उसका वो बहुत ज्यादा उसका वो हो जाता है। उसका जो लो सेल्फ एस्टीम, ही केम विद दैट ओनली कि मेरे 4 इश्यूज हैं। मैं रिलेशनशिप विद हेल्थ बहुत, लिटरली बहुत ज्यादा खराब। माय रिलेशनशिप विद वेल्थ, व्हाट डू यू डू विद दिस? माय रिलेशनशिप विद माय फैमिली एंड माय करियर इश्यूज। अब आप डील करो। How do you deal with that? And ये person almost 2 years बाद again he's come back because he said मैं बहुतों के पास गया, बहुत मुझे कच्चे मिले, पर आपने मेरा एक सेशन लिया था तो मुझे लगा कि yes I need to go to her only। तो वो जो स्किलिंग है आपकी, जो हम लोग हमेशा बोलते हैं, आफ्टर मास्टर्स ऑल्सो एंड ड्यूरिंग मास्टर्स ऑल्सो एंड बियॉन्ड दैट ऑल्सो, अभी कमल सर इज ऑल्सो ही टॉक अबाउट दोज थिंग्स, विकास सर के साथ भी हम यही बात कर रहे हैं। स्किलिंग इन साइकोलॉजी इज वेरी वेरी इंपॉर्टेंट अदर देन जस्ट द थियोरेटिकल आंसर्स। पेशेंट को उससे क्या मतलब ना कि वो तो आए थे दूर से, जो सोच के आए, 2 घंटा बैठे लेकिन कुछ लेके गए, या ये पर्टिकुलर केस में। So this is what my message every time to people is. So whether I'm here, even US का तो क्या study pattern totally अलग है, but even they are also coming back for SEHR therapies, subconscious energy healing therapies. So combining integration of these three is very very important. Yes, next one. ओके, सो नार्सिस जो है ना, मैं जो बोलती हूँ कि हाउ नेचुरल पर्सनालिटी या नॉर्मल पर्सनालिटी और डिसऑर्डर वाली पर्सनालिटी अलग है। कि जो बुरा व्यक्ति होगा ना, समवन हु इज नॉट अ गुड पर्सन और टॉक्सिक पर्सन, वो दूसरों को तंग करेगा मगर अपना घर तो भरेगा। बट एनपीडी पर्सन वो अपना स्पाउस और अपने बच्चों को लिटरली ही फीड्स ऑन देम, on their character, on their personality. So this is a major difference between a NPD disorder and someone who has maybe NPD either patterns or someone who is not a so-called good person. So we need to understand these basic and subtle demarcations and differentiations. Okay, and then what happens? ये आपके friends में भी you may have seen that or felt that, or maybe your personal experiences sometimes somewhere with other people, that they will give you scars, they'll keep poking you, and then they will expect you to come back to normal as if nothing happened. This is also one of the major symptoms and red flags in relationships. और ये हम जब स्पेशली यंगर लेवल पे होते हैं, आप लोगों की एज ग्रुप के होते हैं, मे बी यंगर वेयर यू आर स्टिल थिंकिंग अबाउट और मे बी कमिटेड बट not have got married or something else in couple counseling, we always try, because Western literature में भी ये है कि the moment you realize this person has NPD, run in the opposite direction as fast as you can, because he is not going to change or she is not going to change. Next 40 years, be prepared with age, tumor है, पाल लो tumor को। I always tell them, so आप आंखें बंद करो, ट्यूमर नहीं है तो बिहेवियर इश्यूज ये वाला नहीं है। अभी एक बार गाली दी है, उसके बाद वो कंटिन्यूस, उसके बाद वो होते ही रहना है। So sometimes confrontation therapy in a very crude and rude manner, but with your integrity intact, तभी तो लोग आपसे सुनेंगे ना इस टाइप की बातें एंड अमल भी करेंगे। दोनों बातें हैं। So your integrity and courage of conviction should be super duper over there. So you can't fix a narcissist. वही हम बोल रहे हैं, we need to understand that. बहुत बार पेशेंट्स आते हैं, विक्टिम्स आते हैं एंड दे से कि हम क्या करें, हम ये ठीक हो जाएगा कि नहीं। उम्मीद है 10 साल निकाल दिए, शायद आगे भी निकल जाएंगे। देयर इज वन डेंटिस्ट फ्रॉम यूएस जो मुझे चेज कर रही थी, अगेन शी सेड एज पर हर लैंग्वेज फॉर 6 months, देन फाइनली शी got the courage to connect, 25 years of marriage, and she said ma'am इतना तो निकाल दिया ना, और कर लूंगी। बट अभी भी शी इज स्टेइंग इन यूएस, शी इज अ डेंटिस्ट, लेकिन जब उसका हस्बैंड घर पे होता है शी कैन नॉट टेक द कॉल। She cannot talk to her therapist on call. So is this normal? फिर वो चाहे वहाँ है चाहे इधर है, is this normal? So we have to read beyond the lines about behavior, and that is where Vikas sir is also going to tell us about कि BT बहुत सारे लोग बोलते हैं the next one. बहुत सारे या सबकॉन्शियस एनर्जी हीलिंग थेरेपी समथिंग वी स्पेशलाइज इन एंड उसी में ही बेनिफिट होता है मोस्ट ऑफ द साइकोलॉजिकल केसेस टुडे स्पेशली रिलेशनशिप कोई भी प्रॉब्लम हो बीमारी हो अल्टीमेटली इट ऑल बॉयज डाउन टू relationships whether it's environment whether it's anything. The next one. Okay, so this so ये pioneer books हैं and every book gives us something interesting about from the cultural perspective, and that is how you will also pick up many good nuances, and then we'll be conducting workshops also on the basis of these. And yes, I'm next one please. I'm going to welcome. Okay, take care. So we'll be welcoming Dr. Rania, and Kanupriya will come about that. But I was just going to talk about what Vikas sir will be telling us, because that is what he specializes in, behavior therapy. I've been talking about Sehat, I've been talking about hypnotherapy, talking about psychotherapy, because psychotherapy only mind 10% mind will talk to your 10% mind. आप मुझे प्रॉब्लम बताओगे तभी तो मैं उसको हील करूंगी ना, लेकिन हिप्नोथेरेपी में आप मुझे नहीं बताओ, सबकॉन्शियस में आप मुझे नहीं बताओ तो भी आपको हीलिंग मिलेगा, होता है और ये एक्सपीरियंशियल होता है, एंड दिस इज व्हाट वी स्पेशलाइज इन एंड वी डू, एंड दिस इज हाउ वी नीड टू कीप अपस्किलिंग आवरसेल्व्स. लेकिन बिहेवियर थेरेपी बहुत लोग उसका नेगेटिव क्रिटिसिज्म में बोलते हैं, इट डजंट हैव अ सोल. तभी थर्ड वेव ऑफ साइकोथेरेपीज एंड नाउ द फोर्थ वेव ऑफ साइकोथेरेपीज इन टर्म्स ऑफ एनर्जी हीलिंग्स हैव कम. बट विकास सर इज गोइंग टू शो अस, विल शो अस कि बिहेवियर थेरेपी में भी बहुत सोल होता है, एंड इट्स अ रियली अ ब्यूटीफुल मोडालिटी ऑफ थेरेपी. बट ये इज ओवर टू कंटिन्यू. वेलकम Dr. Rania.
I'd now like to welcome our international chief guest and keynote speaker, Dr. Rania Lampao, who will give us an overview of narcissistic personality disorder, summarizing its core characteristics, diagnostic dimensions, and treatment considerations. Dr. Lampao is an internationally recognized educator and researcher from Greece with a strong background in cognitive psychology and neuroscience. She has received multiple awards for educational excellence, has been a finalist for Global Teaching Honors, and leads international projects that connect STEM education with the United Nations Sustainable Development Goals. Dr. Lampao brings global pedagogic expertise and a research-informed perspective to clinical and educational discussions. Let's welcome Dr. Rania.
Okay, good morning. Am I audible? Okay, thank you. So, distinguished guests, esteemed colleagues, researchers, clinicians, and participants from around the world, good morning from Greece, from Athens. I'm very honored to be invited to this very interesting and very enriching international conference on narcissistic personality disorder. I would like to extend my heartfelt congratulations to all organizers of HCAP, Institute of Psychology. And also would like to warmly thank Dr. Kamal Sharma for his kind invitation. And I think that this gathering today marks an extraordinary opportunity for professionals, for scholars, for mental health advocates to come together in pursuit of understanding one of the most complex and often misunderstood aspects of human personality, narcissism. Today, I want to focus on digital narcissism, and in particular on technology validation, the reinforcement of narcissistic behavior. Before starting share my presentation, I just want to say that here in the Greek Ministry of Education, where I'm working the last years, I'm conducting a workshop on cybersecurity with students of primary and secondary education. In the course of these seminars, I have observed the significant and concerning trend among students. Many young individuals are exhibiting mental health challenges that appear to be closely linked to pressures within the digital environment. And these challenges manifest in various forms, including heightened anxiety, distorted self perception due to persistent social comparison, and an increase in narcissistic traits influenced by online validation culture. And furthermore, there is a growing disconnect between students' online interactions and their understanding of healthy, authentic relationships. As educators, many of us find ourselves insufficiently prepared to address these emerging psychological and emotional needs of students. So we often lack the specialized training required to help students feel safe enough to express their concerns, to speak openly, and to seek support. Recently, I want to say that here, what happened in Greece, we had a tragic event, one tragic example which underscores the urgency of this issue. During a recent school excursion, a student attempted to take an attention-grabbing selfie near a cliff in order to share it on social media. So, in doing so, she lost her balance and fell, resulting in a fatal accident. This heartbreaking incident highlights the profound impact of digital era pressures on young behavior and well-being and reinforces the need for a holistic approach to cybersecurity education and one that includes mental health awareness, of course, and emotional resilience as key components. So I will start sharing my presentation. I hope it's visible now. Okay, so I will start with some questions. How has the rise of social media platforms influenced individual self concept and identity construction? In what ways do algorithms and recommendation systems amplify self centered or performative online behavior? Does digital communication encourage authentic self expression or curated self presentation? And how do technological affordances, likes, comments of readers, actually impact user sense of self worth? So, validation economy of attention. Are digital validation loops, such as notification, engagement metrics, intentionally designed to reinforce narcissistic behaviors? So first, we can see that digital validation loops, so things like comments or views or shares or streaks or follower accounts, are not explicitly designed to foster narcissism, but they are intentionally designed to maximize engagement. The goal of most social platforms is to keep users returning and interacting. Engagement metrics and notifications tied to them exploit dopamine, the driven reward systems in the brain. And these systems are variable reinforcement schedules similar to slot machines. Reward the users predictably, making this behavior addictive. So, while fostering narcissism isn't a stated aim, amplifying self focused behavior is an effective side effect of increasing engagement. The psychological mechanism, because digital validation loops, here you can see, for example, how they reinforce self-presentation. Users learn what kind of post can earn approval and curate their online identity accordingly. They link self-worth to metrics. Over time, likes and followers become proxies for self-esteem. They encourage upward comparison. Constant exposure to others highlights it's something that fuels self-promotion and social comparison. And this creates this feedback loop. Attention, reward, reinforced positive behavior, and more attention seeking. All these mechanisms align with narcissistic traits such as attention seeking, image management, and external validation dependence. Research supports this connection, though causality is complex. Actually, studies find correlations between social media use intensity and narcissistic traits, particularly grandiose narcissism. Experimental work shows that receiving likes activates the ventral striatum, it's a reward-related brain region, and platforms' emphasis on quantified social approval number badges or rankings increases self-objectification and social comparison stress. So this, of course, affects are not uniform. They depend on personality, on age, on context. But social media can also reinforce prosocial or creative behaviors in users who seek a connection rather than admiration. We can admit this. So the design ethics dimension, from an ethical design perspective, the issue is one of incentive. Platform success means more engagement. Engagement is maximized by triggering emotions, especially those linked to self-consciousness, validation, and comparison. And therefore, even without intent to foster narcissism, the design logic rewards narcissistic engagement patterns. Some designers and ethicists describe this as accidental narcissism, which an emergent, actually, what is this? An emergent property of engagement optimized systems. And this is actually an architecture of digital narcissism. How all these platforms now design and with this influencer culture normalize self-centered identity. For example, if you take Instagram, other extra comments lead to self-promotion for approval, with narcissistic reinforcement. Snapchat, the tricks have to do related with status-driven interaction, or TikTok, the algorithmic virality, which leads to attention-seeking escalation. So even when they're not explicitly engineered to foster narcissism, this mechanism reward behaviors that mimic narcissistic traits, self-promotion, attention-seeking, image control, and emotional sensitivity to feedback. So at the same time, we have this influencer culture and self-branding, and this is related to what I mentioned before about the economy of attention. Traditionally, identity was private and relational. You were someone within a community. In influencer culture, identity becomes a product, a brand, to be managed, to be optimized, and monetized. So what are the mechanisms here? That individuals present a curated, marketable persona through the voice, or the lifestyle, the style in general. Authenticity becomes strategic. Being relatable is itself a branding tactic. And everyday users internalize this model, learning to perform their lives online. So, what is the effect? The effect is that it encourages self objectification, seeing oneself as an image to be optimized, and normalizes self promotion and constant audience orientation, core features of narcissism. The economy of attention, because influencer economies monetize visibility and engagement, not necessarily quality or character. So these shares or likes translate directly into sponsorships and income. And this creates a market incentive for behaviors that attract attention, often dramatic or idealized or self-centered content. What is the psychological and cultural effect? Exhibitionism and vanity are rewarded with tangible benefits, status or income, for example. The boundary between self-expression and self-advertisement collapses, and traits once labeled narcissistic, such as self-focus or image obsession, become now professional competencies in digital culture. In other words, what was once a vice now becomes a career skill. The social comparison and social currency. Influencer culture thrives on hierarchies of visibility, aesthetic lifestyles, luxury consumption, perfect bodies. So followers compare their ordinary selves to the influencer's idealized self-image. And this fosters aspirational envy, status anxiety, driving users to emulate the same self-promotion tactics. So this creates what we call a narcissism spiral, Influencers model narcissistic traits, followers imitate them, platforms reward both, and studies show that frequent exposure to influencer content correlates with higher materialism, body dissatisfaction, and narcissistic admiration among followers, particularly adolescents and younger adults. Influences are expected to appear real, but only within aesthetic or emotionally curated limits of vulnerability as a content. So sharing, for example, struggles becomes part of the brand narrative. This blurs actually boundaries between self-expression and performance. And this reinforces at the same time narcissistic self-awareness, the constant monitoring of how one is perceived, even when being vulnerable. So performative authenticity, of course, algorithm reinforcement, because algorithms amplify content that drives engagement, controversies, aesthetics, personal drama, all features of high self-referential intensity. And influencers learn to engineer virality through emotional or visual spectacle. Platforms reward those who embody extreme self-presentation traits, especially or essentially turning narcissism into a survival strategy within digital ecosystems. Over time, these dynamics of normalization, internalization, what is happening, they normalize constant self-monitoring. How do I look? How I'm performing? Recast self-absorption as empowerment, personal brand, the visibility, they encourage the belief that personal worth means public attention, and the result is a cultural climate where the self is both the product and the project. And narcissistic traits are the grammar of participation. So all this, of course, what are the psychological consequences for follows the erosion of self-esteem and authenticity, externalized self-worth, definitely the empathy erosion and objectification, cognitive dissonance, cynicism sometimes. At the same time, well, on the other hand, we have some cultural movements, counter movements and corrective trends like movement de-influencing, the digital minimalism, which is popularized by thinkers like Cal Newport. This movement promotes intentional technology use. Some more authenticity movements like messy realism or collectivism, community-oriented platforms, and of course, what we call mindful branding. So finally, the last part has to do with the strategies, what we can do about it, and what are the strategies, the methods for promoting healthy digital self-expression, because digital narcissism is not simply a moral failing or individual disorder. It's actually an emergent property of design, economy, and culture. Because all these platforms that we use have made the self a spectacle, attention, a currency, validation, a form of control. What we can do here on an individual level, what we suggest is mindful social media use, of course, a curated digital environment also. So this encourages healthy norms of self-expression and social comparison, reflective posting practices, shift focus from performative self-branding to genuine expression, and develop digital literacy. Definitely, this is very important. On a platform level, what is needed is the quantified validation. Instagram's hidden like test, for example, we can mention the BeReal's minimal metrics design. This is an example. And the effect is that it could reduce social comparison and compulsive approval seeking. Emphasizing meaningful interaction. This encourages self-expression aimed at connection rather than performance. Reflective features encourages internal validation, self-awareness. The ethical algorithm design, which reduces incentive for extreme self-promotion and performative narcissism. On the cultural community level, we can promote authenticity norms, encourage movements like Be Real or messy realism that I mentioned before, creators modeling transparency, celebrating perfection, process, and learning rather than polished output. Of course, we talk about the communities. This means foster spaces focused on shared interest, collaboration, mutual support rather than competition for attention. So reward community contributions over individual metrics and shift focus from self-centered performance to relational engagement. Education, of course, and awareness is important because this cultivates critical engagement from an early age. And finally, we talk about a holistic, more integrated approach, which actually show that the goal here is not to eliminate, of course, self-expression or social media, but to reorient it towards connection, reflection, and intrinsic value, reducing the psychological burden of constant external validation. So thank you very much for your attention and for any question here to discuss.
Thank you, Dr. Rania. It was so lovely listening to you, and it's always been especially glad to hear your lovely exit. It was a wonderful, insightful session. It was just like, learning. Thank you for joining, and I'm sure if you could really stay and be part of this for the whole day, going even. But then we considering the schedule you have already occupied, very motivational for me and for the youngsters who are coming into this industry, particularly academics and research. That always would be considered as motivation. Thank you so much for joining. It was so wonderful, and we joined probably. I was just talking to the team that you were so punctual, joining with 3 minutes before the time, and that's so wonderful to be working for a while. So it's been always so lovely, Dr. Rania. Thank you so much for your insightful session. We are out for a kind of short tea break. Please stay tuned. Not leave the session. We're coming back. Over to the end.
We're going to now take a short break for breakfast. Please use this time to engage with fellow delegates. Also, who have not registered till now, please go contact Path to do that right now. And we'll reconvene in 15 minutes sharp. So at 11:30, we'll see you then. Everyone who's joined us online, please stay with us. And we're going to come back at 11:30. So just a 15-minute tea and coffee break for everyone present here. Thank you so much.
So, yeah. So I would like to introduce formally now and welcome Dr. Vikas Sharma. So he is a clinical psychologist par excellence, best behavior psychologist in the country because he has his mentors are the best. डॉक्टर जेना स्पेशली जो बीटी में और बहुत लोग बोलते हैं कि बिहेवियर बीटी में सोल नहीं होता दैट इज अ जनरल क्रिटिसिज्म बट सर विल टेल अस कि बीटी में भी कितना सोल भरा हुआ है इट्स अ सोल स्टरिंग सिम्फनी behavior therapy also which works beautifully and is currently heading the Department of Clinical Psychology at SGT University, has been faculty and a psychologist luminary across various universities. He's one of the board members for RCI, administrative board, and various other kind of inspections and other things. I keep hearing that you have been going. So you are a very important part of the team, the RCI core team as such also, and a very important position holder has been for many years of Indian Association of Clinical Psychologists, the premier association for clinical psychologists in the country today. And the best behavior therapist, as I cannot emphasize this enough, his subject, his specialization over the subject, the way he simplifies it, the way he puts melody in behavior therapy, the way he does behavior therapy, it is par excellent, it is very outstanding, and I think I have learned a lot every time I've been with him, and I've been privileged to hear from him. And yes, a very important thing which maybe many of you may not be knowing, that when I was doing my MPhil, he was my HOD, and that was in 2016 we started off that my journey. So he's been my mentor also. I did my PhD long time back from PGI Chandigarh in 93, and after 93 again various masters and other things, and I'm double net in psychology education. But then I was faculty in Amity University and AICP came into being. He was one of the major brains behind developing the center, the Institute of AICP in Amity, and he's been my mentor in that sense also. So thank you very much, sir. And it's been always a pleasure to welcome you amidst us. Yes.
Most respected organizing chairpersons of this international conference on narcissistic personality disorder, Dr. Swati Sindhu, Dr. Amita Puri ma'am, Dr. Kamal Sharma ji, Dr. Acharya Ravindra Sharma ji, and the entire organizing team. It is indeed a matter of immense pleasure to deliver keynote address on this very important event. I must congratulate the organizers for conceptualizing such an such an interesting conference on a topic which is so important and specific. So the generally in conferences we have a variety of topics and areas, and the result is sometimes we miss the core aspects. So the beauty and uniqueness of this particular event lies in the fact that a very specific topic is chosen for deliberations. And it is also heartening to note that we have speakers not only from India but also from abroad Professor Rania just shared very important thoughts on it. And I think organizers have made my task even more difficult by giving me opportunity to speak after Amita ma'am, who is an expert in the field. And I think after so much of coverage, very less is left for me. So thank you, Amita ma'am, uh, for a great session and such an elaborate introduction of mine. I think you have fueled some of the narcissistic desires inside me. So when we talk about personality disorders, I'll be some bit scientific, bit commonsensical in my address today, so that I can cover the core scientific aspects and also highlight something which is very popular amongst the layperson. So, personality disorders, if you talk about personality disorders, they come under axis 2. We call them axis 2 conditions. Axis 1 conditions are generally the mental health problems like depression, anxiety, schizophrenia. You can give medicines, you can do psychotherapy, and we can treat those conditions, right? So there are certain conditions which are difficult to treat. We call them serious mental disorders like schizophrenia, bipolar affective disorders. So generally, pharmacotherapy is required. We are missing Dr. Sindhu sir today. So he is expert psychiatrist, so very close to my heart. And I think he's in Chandigarh right now. So for those conditions, generally we give medications for treating the psychosis, psychotic patients. And the challenge with psychotic patients is that generally they do not, many a times in most of the conditions, they do not have the insight that they are suffering from any problem. So they do not come to the hospital, rather they are brought to the hospital by somebody, right? So that makes treating psychosis very difficult. On the other hand, if you see the neurotic conditions like depression, anxiety, people have so much of distress that they seek help. From where they will seek help depends on their belief systems. Many of you may be aware of the fact that there are many faith healing practices also which are there. So they go to those places, right? They may go to temples, they may attend some spiritual sessions, and many of them, they come to mental health care institutions for treatment because the distress is high. If you see in psychosis, there is no distress, right? In psychotic conditions, generally there is no distress until unless if there is any specific delusion the person is having, that might be distressing. But otherwise, there is no distress in those conditions. So they don't come to the hospital, right? If you talk about personality disorder, the challenge is that they are sometimes they perform very well in their lives. And this is the reason that their help seeking behavior is very less. They don't come to the hospitals. And it is very difficult for even for their family members to convince them to take any kind of treatment. This is true with most of the personality disorders, more so with the narcissistic personality disorder, because there the individual has this sense of overimportance that I know what I am. So generally, they are not open to any kind of suggestions. This is the problem. So we can say that the symptom becomes, in fact, the barrier to take help in case of personality disorder, right? Those symptoms prevent the individual to seek any kind of treatment or interventions. Taking history of in most of the illnesses, like even in physical illness, right here in Citizen Hospital, uh, the team take care of the the physical health, the mental health, the spiritual health, and whatnot. Like, it is gratifying to see that so many aspects are being taken into consideration in this particular institution. So this is the beauty of the Citizen Hospital. Rather, I think we should call it Citizen Institute, because now there are so many uh, approaches to manage various conditions, which we generally don't find in any normal hospital. We were talking about personality disorder, taking history of a person who is having any kind of personality disorder is challenging, because there is no clear onset of the problem, as it was highlighted by Amita ma'am also, that generally it starts from the at the temperament level, and then it progresses to the adult life. So, this makes it a very kind of a pervasive kind of a condition, and the symptoms are deeply embedded in the individual's behavior. So, so the person does not feel that he is any different from the other people in the life. So this is the problem with the personality disorders, that there is no clear onset of the problem. So when you are taking the history, when we are taking the history of personality disorders, so there we need to actually explore from the childhood and when the problem started. If somebody is saying that the client was apparently well 9 months back, then it means you do not have the scientific understanding of the personality disorders. So we need to explore from the temperament level and then reach to the personality aspects. The assessment of personality disorder also is challenging, because it is not a cross-sectional assessment which we perform, but a longitudinal kind of analysis is required to diagnose any person with a personality disorder. So a longitudinal approach is required. I think all of you will agree with me on this, that we need to explore the history and things like that. So even if you are using any assessment like 16 personality factors test, or any nowadays big five personality inventory is also commonly used to assess the personality traits of the individual, but they are not sufficient to diagnose a person with any personality disorder. That may give you ideas about, or hint about, the personality traits which are present in the individual, but they are not sufficient to make the diagnosis. To make the diagnosis of personality disorders, we need to see to what extent the criteria which are mentioned in the diagnostic the classificatory systems like ICD and DSM are fulfilled. So for that purpose, generally IPDE, which is International Personality Disorder Examination, is carried out, so that, and it is actually a training is required to perform IPDE. And when I was doing my training, so at that time, the the system was that the person was admitted, then along with a family member, and then that particular examination was performed. So a very minute information, details about the person's behavior is required to make the diagnosis of personality disorder. I am talking about making the diagnosis. I am not talking about the specific traits which you can assess by using any kind of personality test. So without making up using the right approach, one cannot make the diagnosis of personality disorder. We should refrain from making the diagnosis of personality disorder, but we can say that yes, this individual is having traits of, say, in this particular case, the narcissistic personality disorder. So we can identify the traits the person is having of narcissistic disorders. So this was about a system which talks about putting people in different categories, like categories of disorders. It can be axis 1 disorder, it can be axis 2 disorder, which includes personality disorders. There are other personality disorders. I'm sure you all are aware of those personality disorders also. So, but if you talk about, if you don't use the categorical approach and we use a dimensional approach to understand the psychopathology, then we assume that all of us have traits of one or the other disorder. But the problem is when those traits, the degree of the presence of those traits is at extremes and it is interfering with your day-to-day functioning, then only we can say the person is having a particular personality disorder. So if I ask you how many of you have traits of narcissistic personality disorder, I think most of you will raise hands. I'll also raise my hand because no one can say that I do not have a single trait of narcissistic disorder or a single trait of obsessive compulsive personality disorder or a single trait of schizoid personality disorder. Right? Am I right or wrong? So broadly speaking, there are three categories of personality disorder. You can say one is A type, B, and C. We can say A belongs to generally the SAD. We say SAD categories, schizoid and all. B, which includes this narcissistic personality disorder, are bad. Bad not in the sense of, but because there are so many of behavioral problems, right? Sorry, the first one was mad, the second B is the sad, bad, and the C, which is anxious, avoidant personality and all, they are the sad part of the personality disorder. So if you have any difficulty in memorizing, so you can keep these things in mind. So it will help you in proper categorization of personality disorders. Now, so these are some of the issues which are related to the assessment part. Now, if we talk about the intervention part of the personality disorders, then intervention also poses challenges. Since, as we already discussed about it in previous presentations also, that it is very difficult for the therapist to make the person realize that he or she is having any kind of the problem. So this is the biggest problem. In case of the depression, anxiety, the person himself or herself will communicate that I am having these problems. But here the person might not say anything. So there the specific challenge lies. So to develop rapport with the client is very important. So the rapport formation of the client is very important. The ability to show empathy during the session, the unconditional positive regard, all these aspects are very important when you are dealing with any patient of personality disorder, right? Rapport formation and all those things are important. Empathy, how do you show empathy to the person? What is empathy? Can anybody, because many of you are young researchers and students, so how will you define empathy? And how will you demonstrate empathy? This is a small group, so I think we can have two-way communication also. There's no problem in that. What is empathy? Are you aware about empathy? What is that?
Ability to understand the feelings and feelings and relate to them.
Right. So how will you are right. Thank you so much. But how will you display that? How will you show empathy in actual psychotherapy session? By listening to the person, okay. Without any judgment, right? So if somebody is saying that, right, please, yes.
Somebody who's raised the hand, put her on.
Lavita, can you please say what you wanted to say? Lavita, please go on. Please, can you turn on your microphone and speak?
How they can type their queries. That will be better, I think. So we were talking about empathy. You spoke about the listening. Is there any difference between listening and active listening? Yes, there is a difference, because in active listening, we also consider the non-verbal aspects of the communication. So generally in psychotherapy, we may not agree with the person, but still we need to listen to what the person is saying, because this we need to respect his or her own perspective, even though in many instances we may not actually agree with what person is saying. So if the person is saying that there is no problem with me, but every other family member, the family members, they are not genuine, or they are creating the problem. So this may be the person's version, but still, can we say that we do not agree with you on this, or something like that? Do you agree with what the person is saying? No. But still we need to listen to what that person is saying. Right. So this is very important when we are doing the psychotherapy or counseling with the people who have personality disorders. So active listening, empathy, these aspects are very important, because here you have a person or a client who is not saying there is anything wrong with him or her. So there, the psychotherapy skills and the micro skills becomes very important, so that you get the information, you develop that kind of relationship with the client. In fact, developing relationship is, you can say, is the bedrock of the psychotherapy process. Without developing the relationship with the client, you will move nowhere. So there is no doubt that relationship building is crucial to the psychotherapy process. And when we are talking about relationship, it is not the general relationship, it is a professional relationship between the client and the therapist, right? So there are professional boundaries in that relationship, and the conversation which takes place during in a therapy setting is different from a conversation which takes place outside the therapy sessions. So that's how the clinical psychologists or psychotherapists are different from the layman. A layman might agree also to some of the facts, but here you are not agreeing to what the client is saying, but you are listening to that person, right? The second important aspect in psychotherapy is that both therapist and client generally there is a mutual agreement on the goals of the psychotherapy, what actually you want to achieve. It is not a one-sided affair, but rather a two-way process wherein both the client and the therapist, they decide upon the goals of the psychotherapy. But the problem is sometimes the client comes with a different frame of mind. The client may be having, say, a medical model in mind while coming to a clinical psychologist or psychotherapist. So that person is expecting some kind of a medical solution to the problem. So it becomes very difficult on part to actually emphasize upon the other model which we are trying to use for the psychotherapeutic intervention. It can be the cognitive model, it can be the behavioral model, it can be the spiritual, as ma'am was saying, the SHET model which madam developed. So those kind of models. So it is a very challenging affair to actually give that framework to the client. So a lot of time is actually required so that the client understands our perspective, because that is actually the basis of the recovery, right? So I will give you one example. For example, if a person is maybe having, say, dissociative disorder and is going to a faith healer for the treatment, so then if that person comes to you, then it becomes very challenging for you to actually emphasize upon the, say, the cognitive model which you are proposing for that particular client, because that client is more inclined towards the those that kind of a approach, right? I am sure you all are familiar with places like Mehndipur Balaji, where so many people having mental health problems, they go there and they try to find solutions for these problems, for those problems. So they have that kind of a orientation, which is deeply embedded. So it becomes very difficult for us to propose an alternative model to that. In fact, if I share my own experience, that many times this medical model is so much trusted that if you propose any other model like cognitive or behavioral model, the client is many times the client becomes resistant to that. They say, "नहीं डॉक्टर साहब जल्दी बस दवा दे दो हम जाएंगे." That kind of approach is there. So lot of skills are required actually on the part of the psychotherapist so that they can actually put across their point and things like that. Second aspect of psychotherapy is that generally what happens when you are talking to another person, then the other person is sitting on that side, the therapist doctor is sitting this side, right? And they are talking about some problem. But in case of psychotherapy, you can just visualize the situation wherein both psychotherapist and the client are sitting on the same side and the problem is on the other side. So this is like that. So जो समस्या है वो वहाँ है, हम लोग समस्या के बारे में बात करके उसको सॉल्व करने की कोशिश करते हैं. समस्या बीच में नहीं है, समस्या आगे है और हम लोग दोनों मिलके we are talking about the problem and then we will discuss it. So this is generally the approach which is required. More so in case of personality disorders, because there the resistance is so high, as was previously mentioned by the esteemed experts. So that aspect is also, that is a crucial aspect of psychotherapy. So we have, then if you talk about the formulation, so the formulation comes. What is formulation? Formulation is actually, we can say that it is a tentative hypothesis which the therapist makes with the help of the client to know the actually what are the factors behind this particular problem. Are you getting my point? The factors which you think are responsible for the current difficulties. This is the formulation. So there are different models which we can use to make formulations. And the formulations will decide what kind of therapeutic approach we are going to use with a particular client. So as Amita ma'am was proposed a new psychotherapeutic approach. So there is a formulation to, if you see, if you are using that particular model, then you need to use that formulation. So if somebody is more comfortable or proficient, I would say, in the cognitive model, then they will make a cognitive kind of a formulation with the help of the client. हम ये बात करते हैं कि ये प्रॉब्लम क्यों हो रही है, क्लाइंट के साथ डिस्कस करके वी हैव मेड अ फॉर्मुलेशन. And if you have made a good formulation, then most of the problems are solved. Because if the person knows why I am suffering, then most of the problems are solved. So even if you have not done any intervention, but you have made a good formulation, it is therapeutic, right? Approach which lacks formulation is like going haywire, going from one direction to the other direction. So you will not reach anywhere. आज हम डिसाइड करेंगे कि मरीज के साथ क्या करना है, कल डिसाइड करेंगे कि कल पेशेंट के साथ क्या करना है, तो इट इज नॉट गोइंग टू हेल्प, बिकॉज साइकोथेरेपी इज ए प्रोसेस. And there are some things which we decide in advance when we are doing psychotherapy. So when you are making a formulation, only after formulation you will go for the any kind of intervention which you are using. So once you have selected which model you are going to use, then you have to make a formulation. And after formulation, you will plan your intervention sessions. This is how we need to work. ऐसा होता है ना कई बार कि कई लोग काउंसलर्स वो जब मरीज आता है उस दिन की समस्या देखेंगे, फिर उसका इंटरवेंशन देंगे, अगली बार वो कुछ और लेके आएगा, उसको सॉल्व करें. ये अप्रोच गलत अप्रोच है, इसको यूज नहीं करना चाहिए, है ना. तो कुछ एस्पेक्ट, तो ये एक प्रोसेस है. हमने पहले डिसाइड कर लिया क्योंकि हम ये मान के चल रहे हैं कि जो प्रॉब्लम का बेसिस है वो क्या है वो हमने समझ लिया, अब हम उस पर काम कर रहे हैं. अब उस प्रॉब्लम की वजह से बहुत सारी जगह दिक्कत आएगी. आज टीचर के साथ झगड़ा हो गया तो अलग इंटरवेंशन चल रही है, अगली बार मदर के साथ कुछ बात हो गई तो अलग चल रही है. ऐसा नहीं है, बिकॉज द रूट कॉज इज द सेम विच वी हैव आइडेंटिफाइड इन द प्रोसेस ऑफ मेकिंग द फॉर्मुलेशन. इज इट राइट? समझ में आ रहा है आपको? फॉर्मुलेशन हो गया. Then, like, if you talk specifically about this particular condition, narcissistic personality disorder, so after you have made the formulation, then you can go for intervention. So there are many interventions which are used. One is like we use cognitive behavior therapy as mentioned by Madam Amita Madam. Then we have dialectical behavior therapy, DBT, which is also very popular in managing the personality disorders. So now the intervention which Madam has proposed, and Madam has written a lot of articles on it, I think it is giving us an alternative to use something else. As Madam said that in many instances CBT is not well received by our client, right? So I think as young researchers, you can do some kind of, you can write case studies, do research on this novel approach and compare it effectiveness with established psychotherapeutic technique like maybe DBT or something like that. And then you say that yes, this treatment is equally beneficial or maybe more beneficial than DBT and CBT. Then it can be very well utilized, and I think we will have something new and maybe more helpful than the traditional approaches which we have right in our mind. So that is also important. The problem which the psychotherapists, the mistake which we make sometimes is we jump to the conclusion very fast, especially when we are trying to, because I think there is an urge in all of us to understand the things quickly. So this becomes a problem. क्यों हुआ? आपके साथ बचपन में ट्रॉमा हो गया था, इसकी वजह से आपको पर्सनैलिटी डिसऑर्डर हो गया. So this is jumping to the conclusion. इतना जल्दी conclusion नहीं निकालना चाहिए. There are so many factors which might have contributed to the current difficulties. So it is very important to ये हुआ. उसने कहा मेरे फादर ने मेरे साथ बचपन में कुछ कर दिया था, अब्यूज कर दिया था, मदर ने किया था, दैट इज व्हाई आई एम हैविंग. सो फिर आप कहोगे कि हाँ बिल्कुल आप ठीक कह रहे हैं, इसी वजह से हुआ है, क्योंकि रिसर्च भी यही कहती है. रिसर्च ये कह रही है, लेकिन उस पर्सन के ऊपर कितना एप्लीकेबल है ये देखना चाहिए. और आपने पहले सेशन में ये कह दिया, फोर्थ सेशन में सेम क्लाइंट ने बोल दिया कि नहीं ऐसा कुछ भी नहीं है, जो मैंने पहले सेशन में कहा था वो ठीक बात नहीं थी. एक्चुअल में अब मुझे लगता है कि मेरी मदर ने मेरी बहुत मदद भी की है. Now you are in a difficult position since you agreed to that in the very first session. So that's why we say that it is not important to respond to everything what the person is saying. It is important to document, listen. The response, sometimes we think that if you don't speak, nothing, I don't know what will happen to the client. This is your own fear, and this might lead to many problems, right? So psychotherapy is it is a very complex aspect, and there are very finer elements to it. So it is very important to take trainings. So you can take supervised training under madam. You have a resource. So supervision is very much important if you actually want to learn the psychotherapy. And supervision also has various dimensions. There can be peer group supervision also. There can be self supervision. You can yourself supervise yourself. How you can supervise? For example, what are the skills you think are important when you are dealing with a patient, client? Psychotherapy skills, listening skills, yes, empathy, unconditional acceptance. What else? Huh? Non-judgmental biases. So you can note down these points on a sheet of paper, and after every session you should tick mark how many you have actually utilized in your encounter with the client. You can do it with normal people also. Normally also we should follow these principles. It's not only in that particular setting, they are relevant otherwise also. That if you are talking to a person, how much time you are giving to the other person to respond to. If you are not giving that much, just cross that point. Next time when you are talking, you try to ensure that you are actually doing that. This is self supervision. I have noted down some aspects which are important, which are crucial. Then I am trying to see how many of those things, aspects, I'm actually using in my psychotherapeutic approach. Who speaks more in psychotherapy? If you are talking about the psychotherapy with the personality disorders, who speaks more? Client, the therapist, clients. So yes, so you are right. Generally, we give more opportunities to the client to speak, but it depends on which stage of psychotherapy you are. It's more that is there. So in the initial stage, the client speaks more. We should give more opportunities to the client to speak in the initial stages of therapy. In the middle stage, both therapist and the clients are active. Middle stage of treatment, you can say, suppose you are taking 20 sessions. So for initial few, say 2 6 sessions, we are giving more opportunity to the client to speak. In the middle stage of the psychotherapy, both the therapist and client are speaking. And in the final stage, since now you need to conclude your session, then the therapist speaks more because you need to say, give a lot of instructions what to do after the sessions are over, how to lead the life, about the relapse prevention, and things like that. So there you need to uh, speak more. The therapist will speak more in the end stage of it. So this is the broad aspect which is mentioned in the research studies which I am sharing with you, right? So this personality disorder, NPD, the prevalence is about, I think, 6%. The lifetime prevalence of the narcissistic personality disorder is about 6%, which is too high if you see. But it often go unnoticed. And as madam mentioned, that generally the family members are the victims of the narcissistic behavior. But there are conditions, there are situations where the narcissistic personality disorder is, there are other comorbid conditions also which are present along with the narcissistic personality disorder. For example, the depression, sometimes there is presence of depression, substance use problems, anxiety issues. So these problems are also sometimes comorbid with the underlying narcissistic personality. So there you have both axis 1 and axis 2 conditions to treat. Now you have to decide which condition you want to treat first. Generally, we focus first on treating the axis 1 conditions. If the person is having depression, anxiety, so we generally treat that first, and then we go for the treatment and management of the personality disorder, personality aspects. Right. So this is I think I tried to cover the broader issues. For more in-depth analysis, I think you can go for the readings, essential readings, which are there. Madam has also written a very interesting book on this particular topic, so you can go through that book so that you develop more better understanding of managing the personality disorder. But don't use psychotherapy without training, without adequate training. This is very important. Psychotherapy is a scientific process, and it is not legal also to deal with disorders if you are not trained. You can assist somebody, you can observe someone, but you cannot directly take the sessions. It is not permitted actually, right? So you need to get yourself trained, take the whatever education is required, necessary education, and then you start, right? And psychotherapy is a journey. Lot of many years are required, right, to gain the proficiency, and still like there is a lot of scope which remains. So that aspect we should understand, that psychotherapy is not easy, simple. It is a very difficult aspect. Although we do not require the gadgets and tools which were I think mentioned in one of the presentations also, that so many sophistication equipment and things like that, they are not required actually. It is like ORS. ORS is a very simple, seems very simple thing, but I think it is the greatest discovery. Madam will agree with me on this. It is life saving. Nobody knows who discovered ORS. We know who discovered, who invented aircraft and things like that, but we don't know who discovered ORS. But it is a life-saving thing. So in psychotherapy, we do not require many big assets and other things, but it is a life-saving discovery of the mankind. So with this, I would conclude my talk. Thank you so much for patiently.
Sas is very much correct in this, and this especially applies to the new interns. And those are the
Mic.
level of learning internship.
यहाँ पे?
Online
So they are new into this field. So most of the students coming for internship, I think that it's not like that. I always emphasize on this thing: take a proper history. Okay, so take a proper history. This is the beginning of the journey. Take a proper history. The rapport with the patient during the session. So only it will require at least 2 to 3 sessions to build rapport. What the new interns are doing, they'll like to give their suggestions. And what we are saying that you your client, you have to push every ideas, their own beliefs, never for formulation. This is very we have noticed this so the first client himself. So okay, so it's a scientific thing. It's a scientific thing. Try to learn and practice and always get being supervised. Yeah. Am I audible?
Can someone in the online setting tell if you're audible? Audible. All right. Somebody wanted to ask something. Can we please put the chat on? Thank you. Neha wanted to say something. All right. Is it okay now? All right. Can we move on? Okay. Yeah.
And please don't go to washroom and any other water break when someone is delivering a lecture. It doesn't look good that is.
Thank you so much, Vikasa, and thank you so much, Swati ma'am. Next, I'd like to invite our keynote speaker and chief guest, Dr. Amita Devnani, who will share her personal experiences with narcissism. She's a distinguished counseling psychologist. Dr. Amita is a distinguished counseling psychologist and an ICF accredited life coach who runs Compassionate Minds and is associated with Ananda Center for Counseling. She specializes in practical therapeutic approaches, including cognitive behavioral therapy, mindfulness, and compassion focused work. Dr. Devnani is also active as a trainer, a speaker on mental health awareness, corporate wellness, and resilience building. Let's welcome her.
Hello. Am I audible? Yeah, okay. So, hello everyone. I'm really grateful that Sir and Amita ma'am has invited me to talk over here. This is actually not very much my area of work to work on patients and disorder kind of a thing. Since I'm a counseling psychologist, I'm not a clinical psychologist. So, but since I am in the profession, many people connect to me. Many patients come whose maybe their relatives and their people around them are dealing with narcissism. And since I have done the podcast with Amita ma'am thrice in the narcissist subject, and that has been my most viewed, most commented, and most liked podcast actually. So thank you, Amita ma'am, for creating this awareness around it. I think when I have met you, at that time I was not actually very much aware about the, though I knew that there is something like narcissistic personality disorder and little bit about the things about it, but not in such a depth how much prevalent it is in society, how many people are suffering through this thing. I just got to know when I did my first podcast about the narcissism, and many people, the comment box was flooded with comments that I am also dealing with it. My husband is like that. My wife is like that. My mother-in-law is narcissistic personality disorder. So then I got to know many people are suffering in our society, but they do not even know that what they are dealing with. According to them, maybe their husbands are not good. They are not good human beings. They are selfish. Their mother-in-laws are not good. They are human. They do not know that the people with them who are really torturing them day and night, these people are narcissists. These people have any kind of disorder. They don't know about it. And the thing is, when they know about it, जब उनको पता चलता है कि what's happening here and like what is there, so then they really get shocked and then they think about it how to go beyond it. क्योंकि जब तक हमें पता नहीं कि हमारे साथ क्या चल रहा है, then we do not know how to rectify it, how to work towards it. when जब हमको पता चलता है कि okay, this is what is happening, the person with whom I am dealing right now, the person who is actually torturing me day and night, who is gaslighting me, who is might be my husband, who might be my wife, and I'm shocked when I'm told that many men are suffering because women are more narcissist than men. Because till then I had this point of view that men are more narcissist. But when I got to know, no, many men are suffering in our society. They are silent, they can't talk about it because it's about prestige as well. It's about that if they will talk that their wife is mothers are if they will reveal about it, so there will be something like they are like weaker person, they are not able to deal with it, so they are not revealing it, they are suffering in silently. And after this I have got many experiences as well. Many people connected to me, I would say 60 to 70%, as ma'am said, maybe 80%, the people who were suffering, they were suffering because of the women in their life, like maybe mother-in-laws, maybe their wives. Like the gender thing I am telling you, that the less number of women come to me that their husbands are torturing them or their fathers are torturing them, more men came forward, or more women who are like a bhaktu. So many cases were like their mother-in-laws are narcissists, and which are they're really torturing them in their house, and they are not able to, and men around them and their son, they don't understand it, that what is the problem with their mothers. For them, okay, she is a elder person, you should obey her, kind of a thing is going on in our society, but they do not know how this person is torturing their daughter-in-laws. And then I have seen, really, I have, okay, it's really prevalent, people are really suffering, and many men are suffering, many women are also suffering because in their close circle, or maybe their mothers, or maybe their mother-in-laws, or maybe their daughter-in-laws, they are really suffering because something in their society, their close family has narcissistic personality disorder. And we think that this is our society's structure, that mother-in-laws torture daughter-in-laws. They do not know that something else can go here. So then, and then women are being narcissists than men. What could be the major root cause of it? Maybe it could be only my thought process, but I thought maybe because women are more repressed in our society, because we don't celebrate a girl child as much as we celebrate a boy child. And when the girl is born and you are not feeling happy about it, you are not giving so much love to the child which a child deserve truly, at that time that child starts seeking it, that child becomes attention seeker, and that child, when they have this sense of self low self worth, husband in their life, they think they can control this person, and being this person, we want to hold it because we decide we are really we are insecure, and we want to hold and we want to control the other person around us. It could be a reason, maybe 100% sure about it. uh, when he came to me and he talked about his anxieties, he had health anxiety at that time a lot. So try to control relationship with them. I was not very much aware of things, and but I just about the state in analysis. If anyone, your wife is more of a rebellious child, she must have had some experiences in her lifetime. She's an insecure person, but you can work on her by being more empathetic, by giving her active listening, by being.
People are not able to hear you. One second.
Okay. Yeah, sorry. Okay. Uh, so then, when we discussed this, he understood that maybe he needs to be more empathetic, more loving, more caring to his wife, and he should understand her. Start listening her. He started. Initially, he got good results, but after like 2-3 months, he again connected to me, and he told me that he's really suffering with his wife because she is being very dominating, very controlling, and she is really abusing her mother. They're abusing his mother a lot, and because of the baby, he can't do anything. He can't say her anything. So at that time, when I really heard him, I understood that maybe his wife is suffering with narcissistic personality disorder. Then I discussed with him. I sent him the videos of ma'am with me, and he listened everything. Then he understood, yes, his wife is suffering with narcissistic personality disorder. After getting it, and I'm so happy that person started taking a stand for himself. He started really, I really told him that you will have to take a stand. You can't just let it go and take her over you. You will have to talk about it. If you want to be in a relationship, you want to take this relationship forward. Otherwise, take your decision. If you think that you can't tolerate this and you won't be able to make it forward, take your decision and get separated. And if you think you have to take a call that you want to be this person, you will have to draw your lines, your boundaries, anything. Otherwise, she will be on your head whole of your life, and she will torture not only you, your family, and your daughter as well. Your daughter's life will be ruined. So a few days back, I just connected to him and I just asked him how things are going on in your front, and he said he has really started putting his boundaries. He said he's told his wife that if you will misbehave like this with me or my mother, you will be out of this house and we will get divorced. I won't stay with you. And after that, things have changed a lot. And she has started changing her behavior because that person has took the stand for himself. So I think narcissistic personality disorder people, they do not have this consciousness, maybe because of the brain, whatever the brain has defect, as ma'am said, that their brain things have changed. So maybe they do not have this awareness that they should be more empathetic. They should understand other person as well. But if we as a sufferer, as a victim, or as a counselor, if we know that if we are dealing with any such person, we will have to draw boundaries with them if we want to take this forward for a longer period. Either we should take a call, okay, we can't deal with it, let me just take a call and let me live my life peacefully. And if you are in such position that you can't take this call, then at least draw your boundaries is very important. Otherwise, if you will not draw your boundaries, you will be in guilt feelings. You will think maybe I have, because these people play in such a subtle way. They so much gaslight you that you think maybe you have done something wrong. Maybe there is something you haven't provided them properly because they gaslight you so much. if you understand this thing and you really start putting your boundaries, and if not, if the person, if the victim is not able to do it on their own, they must take therapies. Like with Amita ma'am, I have learned this with Amita ma'am. I had just followed one case with Amita ma'am, and she really taught me how to draw the boundaries with a person. So yeah, I think if we have to be, and it's real, we should understand this disorder is very prevalent in our society. If we want to deal with it, we should know how to do that, get trained for it, know the sign and symptoms for it. We should not just label anyone, because I'm really afraid of this thing also, that people very loosely label other person as well that they are narcissists. So really understanding what are the real symptoms of a narcissist person is very important. Apart from it, we should get trained how to help the victims, or how to understand the narcissist person, if he is really narcissist or not, or we are just thinking because we have heard some stories around it. So I think that's what it's all about. So, yeah. Right, right, right. Hmm. We can say about it, if the person is we will have to understand the spectrum where that person is. If that person is real, like a 5 number, if we say about 1 to 10 is in a 10 in the spectrum, and we know that he will never, and we understand this thing by experience, and the victim also maybe know that this person won't recover. So maybe then we can take a call that how the victim can maintain their situation. And if we know, maybe I think clinical psychologists were the best person to tell you about it, I would say, because about the people who have really disorder, I won't say I'm a right person to talk about it, to be very frank. But I know that how to support a victim who are dealing with it. So I think you can ask this, sir. Otherwise, everything will be assumption, nothing else. Yes, please ask. Right.
Where actually this thing is happening.
Right.
But how does, because whatever is done, they know the truth, and everyone wants to portray
Their best way.
like a victim. So who is right? Is it actually mother-in-law or the daughter-in-law, or is it because son also definitely has the biased opinion? Because no offenses for any males here. It is naturally we all have attachments with
Right.
family origin for it.
Right.
So he's sandwiched in this kind of a situation. But whatever happens between two women in the family, no third person can get. This is what I can tell from my personal experience and also from the experience of the people with whom I interact. Because women to women jealousy, whatever might be the reason for that, patriarchy, societal thing, suppression, there are many multiple factors.
Right,
that.
right, right.
But the kind of dynamics these mother-in-law relationship has, this is sucking in the peace of every family.
That's so true.
So whether daughter-in-law is actually accusing the mother-in-law or mother-in-law is actually playing the dirty politics. How would one get to know? How does a therapist get to know about
I know the topic is really getting diverted here. I could only say that in my case, because that person was my old client and I knew him in a like a certain way. When he discussed with me, I got to know that what's going on there. And when he taken the corrected measures, it really worked. But you are right here. The family dynamics are such know who is the person who is sufferer and who is the person who is a perpetrator. We do not know. So it just then हमारी अपनी wisdom पर ही depend करता है. And yes, ma'am.
Yeah, thank you, Dr. Amita. Yeah. So, yeah, wisdom पे depend करता है. And अभी next हमारा session who is taking? Srishti is taking. Acha, Kamal sir. Okay, after Kamal sir. So, Srishti will be talking about NPPT. Again, this test has been developed, constructed, and, you know, PhD people also have done with the test now, and more than 30 research papers have been published. So, it's not only कि हवा में बात कर रहे हैं क्योंकि abusive है कुछ है. There are two, is a subtle dichotomy between anger and these kind of dirty politics and abuse and a disorder. So, how do we differentiate that? Again, expertise which comes with experience, one, and then we have assessments well in place. So, हवा में बात नहीं कर रहे, थर्मामीटर लगा के चेक करके बताते हैं कि 99 का बुखार है या 104 का बुखार है. So, it's like that. Yeah. So, we have these tests.
Thank you so much, Amita ma'am. I'd now like to invite Dr. Kamal Sharma, who will talk about narcissistic personality disorder in the modern society. Dr. Sharma is a psycholinguist and a professor at Gurugram University. He's also Lean Six Sigma certificate from USA and awardee by Linguist Society of India and United Kingdom. Dr. Kamal will explore how evolving social structures, digital influence, and interpersonal dynamics contribute to the rise of narcissistic tendencies in modern life. Please, sir.
Kanu, you put me in a very bad situation, actually. I feel that I'm victim of your narcissistic behavior. NPD. I'm saying so. Okay, I'll talk in. Guys, those who are online, can you raise your hands if I'm audible to you also? On the screen. ये sequence थोड़ा सा गलत हो गया. I should have been the first one to speak, and then those experts should have come. Now, after Amita ma'am, then Dr. Vikas Sharma is kind of brought that to me, and then, is it better? I can hold it. Check it out. Then Amita, and then me. So I feel you're so narcissistic in that order. You designed it, right? Two things. I'm not supposed to, somebody should have few words on female narcissism. Population, I'm not supposed to do that. So let's avoid talking about female narcissism. I'll just talk about a bit of a concept. Obviously, you have already heard the so once they're done, having hearing that, NPD. One thing which I would like to add on, obviously, if you Dr. Brahm joined, so we are that team which I have with the.
So you're not audible.
Am I audible now? Am I audible now? Anybody on the screen?
Yes, sir, you are.
Okay. Uh, Respected chief guest, respected guest of honor, keynote speakers, such kind of events now have started happening, but you would not find such, diligent team working and especially conducting sessions on such important topics like narcissistic, NPD, narcissistic personality disorder. Coming to a very important concept where I'll just quickly brief it because we are already running short of time. We have papers to be presented. The people waiting online also they have to present scholars obviously, and then we have scholars here. Our scholars, those who would be presenting. Uh, I would just like to fetch your attention on the factorial contributions of things which actually develop narcissism in human. There are various factors. We already had, 3, 4 insightful sessions on NPD, the factors which actually work and build that narcissistic development and that, capacity where somebody behaves majorly. Obviously, we've already learned today that the major three things, three symptoms narcissistic, you know, personalities have is obviously lack of empathy, samvedana, right? The excessive love of admiration, and then obviously very fragile esteem. Major three, sir. Then there are others also. We go deep into it. We've already heard it. How these things actually develop. Do you think it's a kind of overnight that something, but you sleep good, tomorrow you wake up, you're narcissistic? No, not at all. It starts right from the beginning. When a human is born, we have been talking over the years, ever since we started talking about society. There are international debates going on. There are, international talks. They keep on going. I've been a part of some of the talks, when experts really talk about that, what factors really contribute. One of the factors, there are many, obviously. One factor, because I have very limited time today, probably some other day we'll go into in detail about those factors, and then we have experts to hear from. And that is neurolinguistic programming. Coming onto my topic, and that's how I'm saving myself, speaking, saving myself from, avoiding to speak on NPD. And that's very important, Srishti, I tell you. When a human is born, everybody is born with one device, which is there in the back of the mind, that is LAD, language acquisition device. We also call it linguistic acquisition device. Linguistic, into psycholinguistics, we generally analyze that how that acquiring of language, acquiring of that communication. One myth which I need to brush today, and that's what I've been doing. We do that whenever we have conversations about psycholinguistics and how linguistic acquisition plays an important role in building up those traits which might lead to some of the disorders, like NPD is one of them, highly, highly sought after. There are research being done. Our scholars are writing papers on. Universities are holding conferences. International conferences are being held because, see, when I walk around and analyzing on a scale, I find obviously I am one of them, and then everybody I see, one or the other. Somebody is on scale of 1 to 10. Somebody is just on mark 1. Somebody is on 3. Somebody is on 10. Almost everybody is becoming that narcissistic. Certain factors like how social media is, dwelling people into that isolation, which is playing that important role, and suddenly realize that, oh, this person was eventually having spent that much of the time on social media, that fostered that kind of isolation into that personality, and eventually some symptoms started coming. Coming back to LAD, linguistics, when a child is born, he starts, communicating with the world. Obviously, the parents, the family, their communication, everything gets registered here. The words, the languages, verbal or non-verbal communication. And I'm just giving you a very basic idea about how that plays an important role and how that contributes to building those traits, especially into NPD, which is one vertical, sir, linguistic, we call it linguistic narcissism. Another, variety of narcissism, that is linguistic narcissism. How it is built. When child is given that kind of exposure right from the transaction between the parents, probably. The transaction between, like we were talking about, the mother and the, mother-in-law. Transaction between the father, yeah, obviously, like I said, majority doesn't allow me to speak on female narcissism though, so need to go back home alive. So transaction, and that transaction, how transaction happens, we know, we are all aware that how transaction happens between two humans is the way we communicate. That communication, whether it's verbal, non-verbal, sign languages, or there could be, whatever you speak, or whatever you, even the kind of you throw a smile, that's the communication, right? So when a child is born and that he is into that acquisition stage, he starts picking up. Is it only the words he is registering? When we go and analyze deep into the psycholinguistics, actually, when a word is spoken, I tell you there are three major dimensions of that word. What he will pick up. Once long back, I wrote one of the research article on that also, LAD. The emotions, majorly, how it is spoken by the mother to the mother-in-law, or from the father to the mother, or from vice versa, mother to the father. We know, and we encounter these scenarios on a daily basis. The emotion is also a word. In a layman's language, it is that a word has been spoken and that's it. No, the word has been spoken, that carries a lot of things. It has a connotation. It has a different emotion how the word has been spoken. It has a different intonation as well. These things have to be picked up by the child. Eventually, over a period of time, how emotions are carried from one person to another, how these intentions are carried from one person to another, eventually would become one of the traits in that child who is keeping around. Is it so surprising? No, and we have, it is nothing new as well. In our Vedic culture, we know that we have scriptures who have spoken very loud about it, जिसको हम बोलते हैं संस्कार, कि बच्चे में किस तरह के संस्कार जा रहे हैं. So our scriptures have spoken about these things, right for centuries. Giving an example from the scripture also, which I feel very important, and you would realize that it is not something new, right? अभिमन्यु को चक्कर में sin को break करने का idea कहाँ से मिला, and where he was that time? In the womb of his mother. His mother was listening, and all that acquisition was happening. Out of that story, he courage, you see. और जिसको हम बोलते हैं कि बच्चे में संस्कार है. Certain acquisition styles. Obviously, I'm sorry. I'll quickly brief it up. We are running short of time. We have a lot of papers to be presented. So I'm always available. You can hear me anytime. So there are certain linguistic styles, which play and contribute majorly into developing narcissistic personality disorders. But today, now I have been asked to speak on narcissistic personality disorders in modern societies and the major factor which play, out of which, majorly I would suggest that, which really grabs my attention is the isolation which has been fostered by social media. Considering with a very basic and simple table for people, for members of the family, having dinner with one hand and with one hand scrolling, the father scrolling onto something, the mother is scrolling onto something. Schools are now in the fashion that right from the third standard, they want their kids to carry on a tablet. Yeah, obviously, we cannot deny that technology is somehow something we can refrain from, but limitations and like Amita ma'am said very nicely that setting boundaries is something very important, not only from the humans, those who are narcissistic, also with the things which can actually foster those traits into it. And trust me, it is well built here or online, anywhere, you raised hand, I raised hand simultaneously, and everybody could do that. Because to some extent, we have become addicted. Let's agree and very honestly agree to it. Spending that much time into isolation, simply scrolling onto either Insta or young generation might be on Bumble or a lot of things. But then this is happening. Major factor which fosters the isolation. Now that isolation leads to that kind of trait which and later on these situations become a little worse, and then we have experts. Obviously they're also supposed to run their businesses, but cutting that loose, setting boundaries for ourselves, so that we can work back to the basics and then become traits which might be a little problematic. So that is, all. We have also, especially into when I say whether it is astrotherapy, psychoastrotherapy, then therapeutic intervention capacity, which we are already working, and then we run sessions for professionals also that is into psycholinguistics, which actually has professional building that kind of communication on the basis of that communication at a perfect relation with the client. That also one project we did here where uh, psychologists and therapists from across they connect, and then we that's a kind of 20 hours capacity building session we conduct for the professionals also, especially onto various verticals. So once again, would congratulate all the people, those who are present here. It was all insightful. Thank you, ma'am. Thank you. It was your vision, Dr. Swati Sindhu's vision, and Dr. Puri's vision that you. And yes, coming to your question.
I had a question. So, like parents and caregivers, the way that they respond to how children are now they're acquiring language, it plays a good role in how they do acquire language and the confidence that they have, right? So, how in today's day and age, there's this great concern that parents are very pampering with their children. So they're very constantly giving contingent and positive feedback, sometimes even when it's not required. And that versus the fact that during earlier times, that was not the case. With parents who were a little more strict when it came to how children would acquire language and stuff. So, how would you say that this difference plays into the development of narcissistic personality disorder?
Adding one more thing to a question. it is very old term that we listen that parents are very pampering. In India, what is now institutions and authorities are becoming more pampering, like CBSE. Today, if you look at the academic, arena, teachers are more stressed, right? So let's go one level ahead. Earlier, we used to hear, oh, parents are pampering. Now, authorities are pampering. And if I have to give my personal opinion, I'm sorry, I am not supposed to give my personal opinion right from the dice. It's being recorded, but then they're ruining the country, actually. Like I said, how it plays an important role. Let's get to the basics, Let's get to the basics. Pampering a child would not only hamper, his upbringing, very, commonly find the symptoms in kids he can find who have been given a lot of pampering from parents. Teachers are now bound to give that pampering. They have to make their bread and butter, right? When I was in school, I'll correlate it. And then you would understand when my teacher gave homework to me, I was in a government school in government school. Teacher gave the assignment, coming back home, sir, you remember those days? हम उन दिन को याद कर सकते हैं आज भी मैम आपको हमसे बहुत ज्यादा सीनियर हैं घर आने के बाद खाना खाने से पहले ये डर होता था कि पहले अच्छा मैथमेटिक्स के टीचर हैं बोला राम जी उनका होमवर्क पहले कंप्लीट करना है चाहे कुछ भी हो once I could not complete it in daytime and then I was so scared शाम को लाइट चली गई then I had to run my father go and bring वो लैंप लेके आइए तेल का और वो जला के I had to complete that homework because I was so scared I started crying and believe me that teacher it was not the fear actually I would say that it was more important and that teacher played very important role in my life building my life my father my parents आज आज वो पैम्परिंग बच्चा अगर घर पे रोते हुए आ गया तो पेरेंट्स मदर फादर स्कूल वालों की वॉट लगा देंगे टीचर को शायद हो सकता है उसी टाइम फायर कर दिया जाए राइट बच्चे को टीचर्स को एडवाइस दिया गया है सीबीएसई की तरफ से कि आपको तो बच्चे को हाथ नहीं लगाना है क्योंकि हमें सुसाइड्स रोकनी है Ask these idiots. I keep on asking. I wrote one letter to CBSE when this regulation came into, and I am in the capacity to write letters and ask questions. It's a democratic world, and I asked them very loudmouthy, just to stop. I know there have been incidents where teachers were on the wrong path and misused their capacity, and they fostered that kind of stress where the student had to commit suicide. But I would come around just to stop few societal cases. Would you dare to ruin the entire future of the country? That was my question. Pampering is good, but then coming back to Chanakya के वो जब तक बच्चा बहुत उसमें होता है pampering is good, but that should have some limitation because if that crosses that limitation, बहुत ideal symptoms हमें commonly symptoms मिल जाते हैं बहुत जिद्दी होते हैं बच्चे जिनको बहुत ज़्यादा pampering मिलती है they become so rigid kind of people. There are symptoms like that. Linguistic pampering में भी ऐसा ही होता है. If you are giving a lot of linguistic pampering to the kid, then he would have different symptoms. Yes.
So nowadays, double binding is also a phenomenon which is very much
Indeed, it is.
right?
Indeed.
And double binding, in a sense, as in the parent is trying to pamper because he wants to fit in the society, but from internal, they're feeling some something else which is clearly detected by the child. And we are detecting it that the parent does not want to pamper me in this situation, but they have to.
Yes, there are individual factors, Shivani. There are, yes. And these factors play important role. Sometimes, parents are driven by certain factors where they have to pamper kids. Sometimes it comes from internally. Sometimes the father has to pamper just because he is scared of the mother. Sometimes, right? Most of the cases, I have to do that. Most of the cases. The Like I said, yeah, I have to go back alive. Right. And sometimes mother has to praise because she has to have measure of the hold on the kids and so many factors. Yes, double binding that plays a very important role in the development of certain traits in the personality. Thank you so much. I've taken a lot of time. Thank you so much. Thank you so much.
Thank you so much, Kamal sir, for such a candid session. Let's start with the presentations now. Before we start, there are a few things that I'd like to tell all the people who are presenting here as well as online. Can we open the chat box that we know that they're listening? And they can respond as well. Thank you. Anyone who's presenting online and people who are presenting here, there are a few rules to follow for today. The presentation should be... Yeah, I have. Yeah. The presentation should only be of 8 minutes, maximum 9 minutes. The first bell is going to ring at 6 minutes. It's going to sound like this. And the second bell means that your presentation is over. All the question and answers related to any presentation that are happening today will happen at the end of the session. After the workshop is done and the closing address is done, we'll do the question and answers on a one-to-one basis. So let's finish this and let's start with the presentations. Our first presenter here is Dr. Srishti Bhatt, who has over 30 papers published nationally and internationally, and will talk about advancing the measurement of narcissistic traits, development and validation of the Narcissistic Personality Pattern Test, which is NPPT. Her study highlights the importance of precise measurement in understanding narcissistic patterns. If there's any question online about the presentations, and people who are presenting can ask right now, because then we'll start with the presentation. Then we'll move on. Anyone in the chat who wants to ask anything related to their presentations or any questions? All right, let's welcome Dr. Srishti. Thank you.
So hey everyone, a very good afternoon to all present here. It was supposed to be in the morning, but now it's afternoon. So yeah, I just hope everyone is feeling a little uplifted. Really sorry to be here though, to have to present on a very great topic, which is NPPT or NPD in a nutshell. So hi everyone, and thank you so much Kanupriya for giving my introduction. So hi everyone, my name is Dr. Shrishti Bhatt, a psychologist and currently a PhD scholar who is working around this particular topic of NPD. And there was this intervention which we have created or curated named as Narcissistic Personality Pattern Test. So if we talk about NPPT, it is basically a questionnaire which has 20 set items, and we'll be discussing that further. So in this particular slide, I'm going to talk about the challenges that we came up through and we thought to make this particular assessment in the first place. So challenges with NPD or Narcissistic Personality Disorder is that it poses disability diagnosis and treatment of it. Now, being a personality disorder, it is difficult to give them a particular set of therapeutic interventions, as CBT won't work and they are rigid in behavior. Right? So also with NPD, they have a number of comorbidities with it, like there are multifaceted characteristics as written as well. And no doubt there are a number of personality assessment tools, but none like the one which we have. Obviously, I can write that down to you people. Onto the psychometric strengths. So we applied the test in a test retest formulation where we checked the reliability, which is strong, The inter-rater reliability is also high. Validity is supported in content validity, face validity, and construct validity. Further, the solution which is created is the NPPT test. So it was created in a structural multidimensional manner, wherein it covers 7 different dimensions, which we have talked about, which are also a part of how we diagnose NPD, which is basically grandeur, attention seeking, entitlement, exploitativeness, lack of empathy, envy, and arrogance in the client. And where can we apply this sort of assessment? So these can be basically an accurate diagnostic assessments. So you can apply it in a personalized intervention in a clinical setup, in a hospital setup, in schools, in organization or education setup, or in forensic sciences as well. Next slide, please. So in the literature, just to give you a research that how we came up with this. So a lot of research was done behind it, and a number of papers were read and published under the supervision of clinical psychologists. So obviously, my co-guide is Dr. Amita Puri ma'am. So under her guidance, we went through all of this. Conceptual gaps were basically existing, and the research whereas there are many more, which is manipulation, lack of empathy, envy, arrogance, rigidity in behavior. And we just wanted to seek that into the attribution of leadership as well, which is shown by the client, and the confidence which the client shows. Further to it, we have integrative frameworks. So when we talk about the integrative frameworks, it basically shows that a number of papers being published, as said earlier as well. Yes, me and Dr. Puri and many more of our team members and one of our PhD scholars who will later present the paper has actually published more than 30 papers on the test using NPPT nationally and internationally, which is also been published in a few Scopus Index journals and UGC Care journals. That's like a proud moment for me personally. And the therapeutic modalities which we work around with them is art-based therapy and subconscious energy healing therapy, SEHAT. Again, a new comorbidity which Dr. Puri and I came up with. Further, it actually just basically works onto the behavioral challenges and the subconscious healings that we're going around with, and art therapy quite obviously used when you have to make a client talk about their undergoing their challenges. Next slide, please. So when we talk about the methodology, I'm just going to discuss the item development and how the test was made. So has 20 items, which is basically being differed onto 7 domains, which we just spoke about, and it is on a 4-pointer scale, 0 being the highest, and 0 being the lowest, and 3 being the highest. Next slide. These are the 3 pointers which we kept in mind while curating this intervention, which was the psychometric evaluation. Reliability testing, test retest was used just to see the stability of the test, and inter-rater reliability was quite high, which will discuss further in results as well. Just go back to methodology. Validity in the validity verification. Basic content validity was there. Then we also discussed the construct validity through PGI health questionnaire and the predictive analysis, which was examined between narcissism scores and self-report inventories. And the client feedback was that it is actually great predictables and very direct to use. Next slide. So here are the results which we already discussed. The test retest reliability is strong correlation. Inter-rater reliability is 0.79, which is again a high consistency, and construct validity is again a high correlation. Next page. In the discussion, very 3 major points which I'm going to discuss, which NPP stands for, is it addresses the limitations of existing narcissistic assessments by offering a multi-dimensional structure and the framework for the following, which is overt and covert expressions of the narcissistic traits. So further, which we go around with accurate diagnosis, it is targeted through interventions, which enables the treatment specific and therapeutic interventions. Also, it also talks about process monitoring, progress monitoring, which supports the evaluation further. At last, the research application and broader utility. So research application is basically that it is a standardized cross-sectional test, which is a cross-sectional longitudinal test. It enables exploration of narcissistic subtypes other than just grandeur and vulnerability. And we also talk about the comparative analysis across diverse populations, not just a male and female, but a family, child, adolescents, everyone is covered here. The broader utility is that you can use it in organization sector to see the toxicity in the environment. Second is education sector, where you can see that how the child is being performing or what are the parameters to it. And forensic, where you actually see the personality of the criminal cases. Next slide. This is basically how the tool is divided into 7 main domains. Grandeur has 3 items from question 1 to 3. It seeks that how much the client wants to make believe the person. Second is attention seeking. Again, question 4, 5, and 6 are into this sector, which basically needs to be addressed. Whatever they want to know, they always want that attention, seeking of attention, wanting that validation. Third is lack of empathy. Question 7, 8, and 9 are into this category, which basically talks about the problems and the disinterest that a person has in others' challenges. Fourth domain is entitlement, which is from question 10, 11, and 12. Basically, it talks about how much proud and loud they want to be about themselves. Fifth is exploitativeness, questions come around 13, 14, and 15, using manipulation and taking advantages. Envy is the sixth one, which curates questions 16, 17, and 18, talking about the feeling and jealousy factor in the clients. And the last domain, which is arrogance, items 19 and 20 come into here, basically showing their superiority. So, into the resultants are the scoring range. Scoring range, the lowest trait if ever seen is from the score range of 0 to 21. The moderate range of scoring is 20 to 42. The highest of the severity range or the severe range is going to be from 43 to 60. Next. Contribution of this paper, as you would see further, also already a PhD work is done with this tool in USA. One of our clients, one of our PhD scholars is actually going to present that paper. She used the test. Over 25, actually 30 plus now, have been published in international and national journals to our name and Dr. Puri's name and many more authors who have worked with us. It stands as an advancement in structured and evaluation for narcissistic traits. Further, there are 4 major things which I would just talk about and conclude. Strong foundation is there in this test, which will give you the consistent reliability and validity was showed. Balanced approach towards every domain. Third, the clinical insights. And fourth is the broader impact. So, yeah, thank you so much, everyone. That's all. Yeah.
Thank you so much, Dr. Srishti, for your innovative and well-structured work. Up next, we have Akshat Hadij. All right. Up next, we have Akshat Hadij, who will share an empirical case study exploring the influence of digital content on dissocial personality disorder.
Thank you, Kanupriya. Good morning, everyone. It is my pleasure here to stand and represent my empirical case study on the influence of digital content on the dissocial personality disorder. In today's world, technology is not just accessible, it's almost unavoidable. Digital media has transformed the way we communicate, contact, and even perceive the reality. While it offers the great learning and entertainment, the lack of control and monitoring offer violent and antisocial content that has led to growing concern about the psychological effects. Excessive digital use has been linked to depression, मैंने कल
the following unique characteristics. Confirm gender state. The gender state and officer with this presentation.
I have my हाँ ठीक
This presentation. Then let's wait because he needs his presentation to work.
everyone please wait for a minute while my presentation is being shown on the screen projected. Continuing the same, excessive digital use has been linked to depression, anxiety, impulsiveness, and aggression, and over time, it can shape one's perception to right and wrong. In this study, we introduce what we call a psychological amplify effect. This means the digital exposure does not necessarily cause the dissocial behavior, but it strengthens the underlying vulnerabilities that already exist. Next is the definition. Gaming disorder, classified under ICD-11, is defined by a consistent or recurring pattern of a behavior that may occur in both online and offline contexts, which includes diminished control over gaming activities and escalating prioritization of gaming that supersedes other life interests and daily obligations. Dissocial personality disorder, classified under ICD-10, is a personality disorder which shows gross disparity between behavior and prevailing social norms. Antisocial personality disorder, classified under DSM-5, is a pervasive pattern of disregard for and violation of the rights of others that begins in childhood or early adolescence and continues into adulthood. Next. Next is the case study. Our case subject, Mr. X, who is 21-year-old male, he came in with his family. Actually, he was brought by his family, who has a chief complaints of disturbed sleep, He was agitated most of the time. He had stubbornness and excessive involvement in online gaming. According to his family, please. According to his family, the subject was quiet and introverted and socially withdrawn prior to the COVID-19 pandemic. During the lockdown, he began spending most of the time playing online games called Free Fire. Over the next few months, his gaming habit turned into a psychological dependence. He began using gaming as a way to escape feeling of anger and rejection that came from the childhood neglect and bullying. Gradually, he developed a noticeable emotional and behavioral changes. He became irritable, impulsive, sleep deprived, and often awake all the night playing games. He stopped interacting with the family members and seemed emotionally detached from his surroundings. As his dependency on online gaming increased, his thoughts and beliefs also began to shift. He started showing the religious extremism and absolutist thinking. He began calling himself a Mard Mujahid, which meant a warrior. And he also expressed a delusional confidence in his strength and purpose. In the interviews, he made several violent threats, saying that he would harm his wife and his children as he had a past relationship and he could not marry her. He also made inappropriate and threatening comments over the female interviewer. His family reported that after the pandemic, he became stubborn, aggressive, and easily provoked. He also got into physical fights, often injured himself, and refused to listen to anyone. During later sessions, he spoke about wanting to go under commando style training and even expressed a desire to run for a position of a sarpanch or to be in a great political position so that he could have a power and influence over the people. His thinking clearly shows the cognitive distortion and grandiosity. Next is the mental state examination of the subject. His appearance was agitated, restless. His behavior was aggressive. His speech was rapid, which reflected elevated mood. His mood has grandiose effect. His thoughts were tangential. The contents were paranoid, and he was suspicious of his peers. His perception, there were no clear hallucination or perception disturbance. Disoriented to the ear. He most of the he always said 2000 person he was intact. His judgment was impaired and which evidenced the poor impulse control and aggressive behavior, and he has zero insight about his illness. Next is the methodology. We followed a multi-model approach that combined clinical interviews, psychometric assessments, and diagnostic criteria from DSM-5 and ICD-10. The tools were IPD for identifying personality disorder traits, MRS for evaluating the manic symptoms, and PRS for assessing the general psychopathology. These were conducted ethically and has reliable. Next, after hearing the history of the patient, we assess IPD, which shows the mixed state of schizoid, impulsive, anarchistic, and histrionic. In YMRS, he clearly showed the hyperactivity and agitation. In BPRS, reflected psychopathology included hostility, somatic concern, delusions of superiority. For the treatment, he was given the pharmacotherapy, which included mood stabilizers such as lithium carbonate and sodium valproate, and antipsychotic like aripiprazole. After several weeks, he showed some progress. His aggression was reduced. His restlessness was also in control. But after the BPRS assessment, his score dropped from 57 to 40, and his YMRS score reduced to 33, but he still showed the manic symptoms. That while medication helped him manage the symptoms, but the deeper cognitive and noise by the digital exposure remain unchanged. Overall, this case highlights how violent digital content can serve both as a coping mechanism and a psychological reinforcer, deepening social tendencies and making them more resistant to change. Next is the video of the subject. Play करें. आपको कभी लगा कि आपके साथ कोई परेशानी फील कर रही है और घर वालों को लगा कि आपके साथ कोई परेशानी है. अच्छा, क्या परेशानी फील करती है? अच्छा, मुझे मानने का ठीक. आपका बचपन कैसे गुजरा उसकी? अच्छा, अच्छी बात यह है कि आपको दूसरों से मिलना पड़ा बचपन में. कुछ कुछ इंसिडेंट्स बता सकते हैं. अच्छा, तो उसकी वजह से आपको क्या लगता था कि जो अभी आपका जो काम है तो आगे आपको क्या लगता था कि अच्छा, मतलब कैसा होगा कि मुझे अच्छा और इस बीच में आपको जब पावर लेने की आपके अंदर लंबे भावना आई उसके लिए आपने क्या क्या कोशिश करी और आपकी आपने शक्ति वाली है हाँ और अपने हाँ In this session, I asked him about his childhood. He said he was bullied in his childhood, and after he had an insight that due to his lack of power, he could not able to have influence on other people. That's why he has a desire to go and commando style training so that he could have a physically powerful influence on the people around him. Next. Next is the scope and limitation of my study. This case study gives an important insights about the effect of digital content on the psychology of an individual. But since it being a single case study, it cannot be generalized to the entire population. The findings are based on one individual and it rely partly on family reports. There were also limited follow-up periods. The future study should include larger and more diverse samples. Thank you.
Thank you so much, Akshay. I'd like to request all the people who are going to present now to keep the presentation to maximum 7 minutes as we're running short on time. Welcome Benjamin, who's presenting his paper on construction and development of the empowerment and boundaries assessment. Please come. Please come. Can we do a sound check?
Am I audible? If I'm not audible, please text in that. Thank you. So basically, my name is Benjamin. So just wanted to start with certain things like when we actually have a client, either it will be a victim, or the person who is an NPD in the first place. So there was a question asked earlier also, we'll have to focus on the client, I mean the victim or the person who is actually NPD. So the answer is like basically the person who is victim, we'll have to give the first importance, I guess, because they are the one who has suffered for for several days or something. Then we will move on to the person who is an NPD. So for that, to understand the person, we will have to do the assessments and everything. So what is after that? After we take the assessment, which is basically the baseline, what will we do? And that's how Dr. might come to this particular assessment tool. Like we actually made it. So in this, you can go to the next slide, please. So it's basically what do we need as a human in life, and especially when we are in the close circle, we expect love, right? So if the person with whom we are in love, if that person changes into an NPD, then what's the deal? So we can't just leave the person itself. We have to focus on eradicating the behavior, not the person itself. We just have to focus on the behavior. Hence, this tool help us to understand it. And a lot of manipulation will be happening from the person itself, and they would have suffered a lot of things. But do you think the victim will have an idea of that all these they would have actually faced? No, definitely not, because it doesn't happen in a single day or something. They would have gone through a lot, and this has happened like over a period of time. You can read all the things because on the slide, and basically there can be other assessment to take the baselines only, but beyond that, how as an therapist that we have to proceed, we have to track the progress and everything scientifically, and that's how it will be really really helpful as a therapist. From our end, we can do to the client in the first place for the victims. So over here, you could have seen the main reason that it's not about the symptom reduction, but at the same time, we have to help them with reclaiming the agency of themselves whatever they have lost as an individual, their identity or individuality, we will be helping the victim to regain all this and re-establishing their personal boundaries. There are in this particular assessment, there are four domains that we have actually focused on. One is related to the cognitive boundaries, behavioral boundaries, emotional boundaries, as well as their social boundaries. You could have seen multiple people, either their husbands or wives or their partners, they won't allow the partner to reach out to somebody else, because in NPD cases, they are like a leech. They suck the blood of the person, and then they live in that. It's basically completely on that, and it's like they drain the energy and they live with that. And for that, they will also do anything. They gaslight it, they do love bombing, every single thing. So in all these things, we needed an assessment which can be helpful to understand from our end, to measure the growth of the individual on session basis. Hence, this will be helpful for us as well as for the victims to understand themselves and help them to be positive, positive, and see the change in their partner's life or in their life or their relationship life. Next, Dr. Vikas also mentioned like how we actually focus on how we actually focus on creating the intervention for a specific client, right? So here we have to be very specific, but without knowing the domains, how will we do? So this will help us an idea to where we can begin, and reach me in the mid-session after 3 to 4 weeks or 2 to 3 months, how we can actually proceed further with that specific client. So the first one is the empowerment, and the second one is the boundaries. To understand, to help the individual to make individual decisions by themselves without any influence of the partner or their husband or their wife or anybody in this case, because parents are also there and children are also there. And there was actually one more question: how like females are narcissistic recently, but how? Earlier, like you guys would have seen in movies, if husband says something, the wife will be listening. And what will I like her friends like something like this? My husband will get angry. But same right now today, Kamal sir also mentioned like if I, no you did mention in a way that if I go home today, I should be alive. But it was conveyed in a funny way. So there is a difference. So those things that has happened earlier in our in the previous century, the children has learned it, and that time it was just toxic masculinity, or that has been normalized. Right now, people have started speaking about it. Now people realize that this is the reason, and it's not related to masculinity or femininity. It's related to equity. So we have to.
See what happens in a female life. They study till 23, 24, they will get married. All the ambiences change. Okay, so they will take another 15 years to settle into a new environment.
Definitely.
So they will take at least 40 years of their life to speak for themselves. This is the reason. And by that time they become narcissists. So I don't think anything
Can be anybody.
Because they have suffering from 10 to 15 years.
True.
I see. I think narcissism is the way to survive.
You must know what to speak and when to survive.
And how to like the way you can. Okay. So yeah, sorry, previous slide. I don't need to talk about the boundaries.
Why the passion? Because every day, 2 to 3 days of NPT since he joined the team, he has been working together.
Thank you. So yeah, maintaining boundaries in all aspects, saying no to your partner or whoever is actually in the first place. We have to say no means no, yes, in all in terms of abstract concept also. We should not be afraid of saying what the other person will be thinking. Nothing will happen. Ensure that you are safe in the first place, and we can plan accordingly. And start keeping healthy boundaries slowly, and based on all these, we will be focusing on the NPD NPD clients as well. Next, please. So yeah, so this paper, this assessment tool actually gives a benefit to the people who are the victims of the narcissistic, as well as the therapists, the counselors, the upcoming young generations, and everybody, and in the last researchers, because this is the time I think this word is actually blooming. Not most of the people doesn't even know how to pronounce this name. If I'm not wrong, the word I mean. It's really confusing. Narcissistic. It took me multiple days to pronounce this word when I heard it for the very first time. He was not, claim everybody as NPD, but at the same time understand the individual in the first place, why this is happening, try to help them out, be a support person in themselves, and based on that, take action. If somebody is creating a scene or trouble to another person, please seek for help, send them to help, or you speak with the professionals first and bring the person to the therapist. That's it from my end. Conclusion. Thank you so much, all, and the last time.
Thank you. All right. The project. इसको हिलाओ मत बीच से. हाँ. हाँ जी सर, नेक्स्ट वही कर रहे हैं. Yeah, exactly. I'm calling an online presenter next. Sure, sir. Doing that as we speak. Sasmita, yeah. Yeah, ma'am, Samsmita actually. Okay. Let's start with the online presentations as well. Is Samsmita Maharan ready to present? Can you please turn on your microphone and let us know if you're ready? Samsmita Maharan?
Yes, ma'am.
Are you ready to present your paper?
Yeah.
All right. Now we have Samsmita Maharan, who will present Shattered Self and Stolen Potential, exploring the effects of narcissistic abuse on women's learning and self-actualization. You can take over now, Samsmita.
Very good afternoon to the present delegates and the presenters. Myself, Swasmita Maharana, research scholar from Ravensa University, Qatar. Is my screen visible? Hello? Is my screen visible?
Yes, it is visible.
Okay. So my co-author is Trupti Panigrahi. She is also a research scholar in Banaras Hindu University. So I request Trupti to take over. Trupti, kindly take over.
Thank you, Susmita. But now skin is not visible. Please share the skin.
Sorry. It's visible now?
Yes, it is visible. Come to the next slide, please. Good afternoon, all. In this topic, we are going to discuss about how a male narcissistic partner abused to a female narcissistic partner, due to which the education and self-actualization get hampered. Next slide, please. According to the global scope of intimate partner violence, we see that there are 30% of women who are globally affected by the intimate partner violence. Among them, 26.21% are from India, according to the report of National Family Health Survey data. Now we'll see what is the intimate partner violence. Intimate partner violence encompasses multiple forms of abuse within romantic relationship, including physical, sexual, emotional, psychological, and economic abuse. Intimate partner violence not only affect to the individual but also the other persons, like their children's and other family members, other relationships, as well as the community which is existing around him or her. Next. If we will discuss about what is narcissistic abuse, then we will say that narcissistic abuse is a subtype of uh, intimate partner violence. Previous slide please. Previous. Which affect the self-esteem, relationship control, and impact, and also uh, other relationship also. Next. We all know about what is narcissistic disorder, so that I am not discussing more about this. We prioritize self-importance, etc. Uh, Now we'll discuss about the three-phase cycle of narcissistic abuse cycle. First one is the idealization. In this stage, the narcissistic person tried to convince his or her partner, creating promise and emotional attachment. After that, in the de-evaluation stage, he tried to criticize, gaslighting, and to make her getting lower in his or her confidence. And the third one is the discard, when victim tried to control overally to his or her partner. Uh, Now we'll see what is Maslow's hierarchy of need, and how it is affect to the education and self-esteem of a narcissistic abuser. Uh, the first one, the first stage of uh, Maslow's hierarchy need is psychological need. The second one is the safety need. The third one is the love and belongingness, and fourth one is self-esteem, and the fifth one is self-actualization. Uh, the basic need, which is physiological need, in this phase, the abuser make his partner experience chronic stress, anxiety, and emotional execution, so that the physiological need like food, shelter, etc., uh, the the partner who is get abused, that does not fulfill, so that she feel lowered among his surrounding. And after that, in the safety need, she feels sense of insecurity repeatedly due to unpredictable behavior, manipulation, and emotional volatility of the partner. And in the phase of love and belongingness, the abuser isolate victim from family, friends, and social networks through gaslighting and subtle control by convincing her unworthy of love or understanding. So it disturbs becomes more severe at the esteem level, where victims' confidence and self-worth deteriorated. So, at the stage of self-actualization and self-realization, the capacity to realize potential and to pursue inner whole goal, which is severely controlled.
Hi, I'm sorry to interrupt. Can we please wind this up in the next 1 or 2 minutes because your time's over? I'm so sorry.
So, ma'am.
Yes, sure, ma'am. Uh, Then how we'll see how to recovering from this. First one is psychological restoration, safety restoration, love and belongingness to get more, and esteem rebuilding, self actualization. Thank you.
Turn on the mic, Benji. Thank you so much. Thank you for such a wonderful presentation. We move on to Amandeep Minhas, if she's ready.
Hi, Kanupriya. Yes, I am.
All right. Next, we welcome Amandeep Minhas, who's speaking with us online and is going to present on the topic the impact of mental health initiatives on employee well-being and productivity in the business process outsourcing sector. I'd like to request Amandeep to please keep the presentation as short as possible. We only
Sure.
have 5 minutes per person. Thank you so much.
Right. Thank you so much. A very good afternoon to everyone. And I'm Amandeep Korman Has, a research scholar, and I'm based out of Chandigarh at the moment. Today, I'll be presenting my research on the impact of mental health initiatives of employee well-being and productivity in the BPO sector. So, this study examines not only how such initiatives help employees manage stress, but also introduces a curvy linear or too much of a good thing perspective to understand optimal intervention levels. So BPOs are it's a very vast industry in India. It is known for high stress, long shifts, and constant customer pressure. In response, many organizations have introduced mental health initiatives like counseling, mindfulness, and team building workshops as well. However, the impact of these programs it's not always clear, especially when it comes to how much engagement or how much proactiveness is ideal for this population. In trust and safety organizations and BPOs as well, we see that the employees engage with a lot of content moderation. So they engage in day to day life with egregious content, which also hampers their mental health as they might view certain things which they are not okay with, which might activate deep rooted resentment or sentiments or any such mental health concerns. Moving forward towards the literature survey. So, prior research shows that burnout in call centers can reach up to 74%, making mental health a pressing business issue. Evidence suggests that structured wellness programs and initiatives help reduce anxiety and depression, but the results vary, especially when programs are too frequent or too demanding. This brings us to the too much of a good thing TMGT framework proposed by pioneers Pierce and Aguinis. It argues that even positive behaviors or interventions can backfire when taken to excess. So, applying this idea to workplace mental health, the study explores whether more engagement always equals better outcomes or if there's a sweet spot where well being and productivity peak. So, most organizations assume that the more employees engage in mental health activities, the better will be the outcomes. Whereas this assumption has rarely been tested empirically in the BPO context. In reality, excessive workshops, seminars, programs can cause fatigue, program overload, lot of information overload as well, and even resistance. So the key question I aimed to address through the study or through the research was what is the optimal level of employee engagement in mental health initiatives that maximizes well-being without causing burnout or disengagement. The study had four primary objectives. One was to evaluate the effectiveness of mental health programs in reducing employee stress. Second was to examine the link between these interventions and self reported productivity. Third was to test for a curvy linear relationship as predicted by TMGT, meaning benefits rise, then decline after a point. And finally, to identify the optimal engagement level that balances support with personal capacity. uh, Study was followed by a quasi experimental pre post design over 6 weeks. 50 employees from a mid sized BPO organization, evenly divided between frontline and managerial roles, were taken into consideration. So, intervention components included weekly stress management workshops using CBT, that is cognitive behavioral therapy techniques and modalities, bi weekly mindfulness sessions, individual counseling, weekly team building sessions, and so on and so forth. So, the stress was measured using the PSS 10 scale. Productivity was captured via a validated 10-point self assessment. So, the analysis was done via paired T tests, measured pre post differences, while polynomial regression tested for the DMGT effect, that is diminishing returns from over engagement. The findings during the end were significant and insightful. Stress scores dropped from 29.4 to 22.1, showing a clear reduction in perceived stress. Productivity scores increased from 6.2 to 7.8 on average, indicating better performance. Most importantly, optimal engagement occurred around 87 participation, meaning employees who moderately engaged gained the most benefits as compared to the others when it was more of a regular practice. These are just the tables of the findings in the graphical form. Towards the end, while concluding, I'd just like to say that this study reaffirms that mental health interventions can significantly improve well being and productivity in the BPO sector. However, the key lies in balance. Programs that are too light have little impact, while overly intensive ones can cause fatigue. An optimal strategy is moderate, structured, employee sensitive and centric approach, one that supports mental health while respecting workload and time constraints. So embedding mental health culture into organizational DNA not only reduces burnout but also fosters resilience and retention. So ultimately, when companies prioritize balanced well-being, both employees and organizations, they thrive together. That is the end, and I'd like to acknowledge the foundational work of Pearson Guinness on the DMGT framework, Cohen and Williamson on the perceived stress scale, and multiple wellness studies done by Rand, Jama, and others. These studies guided both the structure and theoretical base of this research. And thank you so much for your attention. I'll be happy to take any questions towards the end of this workshop. Thank you so much, everyone.
Thank you so much, Amandeep. We'll take questions at the end of the conference because right now we are running short on time.
Right.
Next, we have Tanu Chauhan, who's also joining us online and is going to speak on the topic behavioral and psychotraits matrix in Gen Z informal workplace settings. Please take over. Tanu, you need to unmute.
Yes, Srishti. Hi, am I audible?
Yes, you're audible.
Also, let me know if my screen is also visible.
It's not visible yet. It's visible now. Thank you.
Can you see the presentation on the screen?
Yes, we can.
All right. Thank you so much for confirming. A very good afternoon to all of you. My name is Tanu Chauhan, and I am doing my PhD from JP University, Noida, under the supervision of Dr. Rajneesh Kumar Mishra. And today I'll be presenting a paper on the topic behavioral and psychological traits of Generation Z at the workplace. These are the contents which I would be discussing. So moving forward to the abstract. So in the new millennium, in the new world, the human civilization has turned folds with another level of human traits and development capacities based on the behavioral transaction of different group of generations. Generation Z, which is also referred to as iGen, post millennial, or Zoomers, refers to the demographic cohort of following millennials and preceding generation Alpha, generally defined as people born between 1997 and 2012. So, if we take the age statistics as well, so these are the people who are currently, whose age is currently between 13 years to 28 years, and they are entering the industries as well. They are becoming the future workforce as well, current and future workforce as well. So this paper particularly focuses on the study of behavioral and other psychological traits of post millennials or generation Z. So generation Z is the generation which is followed by the millennials, as in generation Y. If I talk about the, I've already given the introduction that this is the generation which was born mid 1990s to early 2010. It is also known to be the first true digital native generation. They have been born and grown in a cyber environment, using technology and interacting in social networks right from the childhood. I mean, in your nearby also, you would observe that there is child who is just born. The mother would give the the mobile to them, and then they understand how the mobile phone works. They know how to play the poems or maybe anything on YouTube. So of course, the Gen Z is the digital native of digital native generation, and they even tend to be seen as addicted to the technology as well. Whatever problem that they face in their life, for every other question that they have in their life, they would quickly go to Google or nowadays to Chat GPT and to look for the answers for anything and everything. The members of this generation have also been called Gen Zers or post millennials. Its main characteristics are defined as they are highly ambitious and self confident. At the same time, they are said to be realistic and accept whatever is given to them. This generation stands more oriented towards the opportunities to expand their skills, which leads to a belief that they will switch jobs more frequently than other generations before them. And if they do not like anything, they will speak it out, and they are ready to change immediately because they do not like any uncomfortability at all. Gen Z is the generation of think and act. It has been observed that they are more aware and informed than previous generations. Gen Z have also stood up to be more financially conscious. They know how to manage their budgets. They have greater freedom of expression and greater openness to understanding different kinds of environments as well. Moving forward to the literature review.
Uh, Ms. Tanu, can I just interrupt for a second? I'm
Yes.
so sorry. Can we please a little bit rush up the presentation because we're running very short on time. So if we can finish this in the next 1-2 minutes, it will be great,
Sure,
please.
sure, sure. I'll
Thank you so much.
definitely do that. I'll
Thank
skip the literature review because I've already given the brief about what Generation Z is and what are
Yes.
their characteristics. So the problem statement is Generation Z stand with cohort characteristics, which define them as tech savvy, risk takers, adaptive, responsive to the communication, self reliant, skill oriented, which makes them more productive. The objective of this study is to understand and analyze the behavioral characteristics, number one. Number two is to understand their psychological traits at the workplace. Number three is to understand the impact of their various characteristics on their job role. And number four is preparing a training need analysis for Generation Z. So in this particular research paper, there was a survey that was being conducted, and the participants of the survey were the managers and the team leaders who are directly managing the Gen Z as their subordinates. And there were certain questions that were being asked in the survey. I've pasted one of these snapshot of 4 questions. I would just quickly read like one or two question, which is, do you agree that people from Gen Z are more dependent on technology in terms of learning and development, or they are more independent, they are self-reliant, they're tech savvy? So as you can clearly see, the blue one shows that the most of the shows the agreement sign. So as you can see that the result is of course lying towards the Generation Z. And ending the presentation, so the result says the study concludes that Gen Z stands with unique characteristics which make this generation as more workaholic and workaholic. And based on the primary and secondary data analysis, we can say that uh, Gen Z Gen Zs are tech savvy, risk takers, responsive to the communication. They're self-reliant, skill-oriented, and also Gen Z also stands far different in terms of tech savvy workforce than the generation Alpha or any other previous generations. And the if you want to increase their productivity, so we can prepare training need analysis, and we can prepare their training programs basis on their specific personality traits. Thank you so much.
Thank you so much. Do we have Nusat ready for her presentation now? This is the last online presentation. Is Nusat in the chat? All right. We'll resume with offline presentations now. Is Priya ready to present? I'll go first. It's okay. Parth, can you introduce me? Thank you. Can we turn on the light? Miss Tanu, can you please mute yourself now? Right, thank you.
Good afternoon. Our next presentation will be Kanupriya B. Kataria on the topic Algorithmic Empathy as the Future of Psychotherapy, Transforming the Therapeutic Alliance in the Age of Artificial Intelligence. This paper explores how technology can complement human connection in therapy and reimagine the way empathy is expressed in digital mental health interventions. Thank you.
Thank you. Slide, Raghu. The other one. All right. Am I audible? If anyone can confirm.
Yes, you are.
All right. Thank you. Can we start? Present full screen? All right. Without taking up too much time, I'll start with my topic, which is algorithmic empathy as the future of psychotherapy, transforming the therapeutic alliance in the age of artificial intelligence. Next slide, please. All right. Over the past decade, artificial intelligence has become deeply integrated into almost every aspect of human life, from personal assistance to education to healthcare. However, its role in psychotherapy is still under a little bit of critical examination. To understand the topic well, first we need to understand what exactly is artificial intelligence. Stuart Russell and Peter Norvig have defined artificial intelligence in one of the most popular books called Artificial Intelligence, a Modern Approach, as the designing and building of intelligent agents that receive percepts from the environment and take actions that affect the environment. In psychotherapy, although AI promises accessibility, it promises faster diagnosis, it promises early distress detection. However, it still struggles to understand how human emotions and genuine therapeutic alliances can be built. Next slide, please. Just to keep it short, the methodology for this paper is conceptual and it's secondary data analysis. I've used research papers, reviews published between 2019 to 2025 on PubMed, APS, and Google Scholars to get my information. Can we go on to the next slide, please? Now, understanding algorithmic empathy, which is the central concept in my study. What exactly do you mean by algorithmic empathy? It basically refers to a simulated form of empathy the one that is created and expressed through artificial intelligence rather than being expressed and experienced emotionally. So there's a difference. The concept combines two different areas of technology. The first one is natural languages processing, NLP, and the second one is effective computing, both of which work together to help machines recognize, interpret, and understand emotions. To simplify the idea, we have three phases. The first one is effective recognition, as we see over here. Second one is contextual comprehension, and third one is empathetic response generation. Please move on to the next slide. Now we'll understand all the phases together. The first stage, the first cue is effective recognition. On this stage, basically, AI identifies emotional cues from facial expressions, tones, and speech. Effective computing is used in this stage, and AI functions much like a therapist. It observes, it interprets a client's emotional state through subtle cues. It is basically a human parallel where therapist observes client's affect and body language. The second phase is contextual comprehension, where AI interprets user input to detect emotional states. Here, emotional states such as guilt and sadness is detected. To simplify it, we talk like when we talk in frequent user words like hopeless, tired, and guilty, it suggests depressive thoughts. By analyzing such patterns, artificial intelligence attempts to understand not only what is being said, but also what is being felt. In simple terms, effect recognition in the first stage is capturing the emotion, whereas contextual comprehension is interpreting its meaning in the context. The AI tool involved here is natural language processing, and its human parallel is basically where therapist interprets verbal and cognitive patterns. The third stage is empathetic response generation, where it crafts supportive responses based on tone, emotion, and data. And the AI tool involved is machine learning models. Can we move on to the next slide, please? However, there are a lot of limitations when it comes to the concept as of now. The first concern, obviously, is authenticity concern. If empathy, it says, if empathy is simulated rather than experienced, as we have understood in the last three phases, can it really provide therapeutic benefit? This raises an ethical question about what counts as the real care in psychotherapy. The second limitation is bias and cultural representation. Because the AI model is learning from existing data sets, these are not diverse in terms of culture or gender or demographics. Staggering new data about mental health. I'm still here. Don't move. The third limitation is data privacy and security, because the data of a patient is very personal. AI tools collect and store such data, and the risk of surveillance is very high. For example, here I've just gone through a movie called Megan, which was released last year. There is a robot that is designed to emotionally support a child who has lost her parents in an accident. At first, it succeeds. It understands her emotions, body languages, and provides support, much like AI does and is designed to do in therapy. But as the robot starts taking emotions and instructions too literally, it becomes harmful, completely twisting the meaning of care. So we understand that this example serves as a psychological metaphor for what could happen if AI-mediated therapy is left unchecked. Emotional care without human understanding can become destructive. Can we move on to the next slide, please? This has revealed staggering new data about mental health crises unfolding on ChatGPT. More than 1 million users every week send messages that suggest suicidal thoughts or plans. That's not all. Around 560,000 users show possible signs of psychosis or mania. Now, the revelation comes amid mounting scrutiny. OpenAI is already facing a lawsuit from the family of a teenager who died by suicide after long conversations with ChatGPT. The US Federal Trade Commission has already launched a sweeping probe into how AI companies assess their impact on children and teens. As the company opens up about mental health challenges, it also moves to loosen some restrictions. But behind the numbers lies a troubling picture. Millions turning to machines, not just for answers, but for help. So this news report basically highlights the growing emotional dependence on artificial intelligence and its impact on human mental health. It also reminds us why human empathy, ethical judgment, and professional guidance remains irreplaceable in therapy, no matter how advanced technology becomes. Can we move on to the next slide, please? I'll do the scope very fast. The study that we've done, algorithmic empathy, it can act as a third pillar in therapy, alongside patient and therapist, creating a triadic model. You can't always say that it can replace human beings as therapists, but it can act as a third pillar. It can support psychologists by assisting in emotion monitoring and session documentation. It can help in reducing workload and enhance diagnostic accuracy. Future research should explore ethics, boundaries, and integration models where AI complements but does not replace human empathy. Can we move on to the next slide, please? Thank you. The future integration roadmap goes where experimental studies conduct controlled trials integrating AI as therapist assistant for emotion monitoring and sessions documentation. Human AI collaboration, where we can develop triadic therapeutic relationships where AI augments human therapists without replacing genuine empathy. And there's integrated ecosystem where we build comprehensive systems combining human ability with algorithmic accuracy for optimal patient outcomes. And then there's conclusion, which is exactly what we've done in the presentation. Next slide, please. And we're done. Thank you so much. Moving on to the next presentation, I'd like to... Can we move on? Abhinav? Okay. I'd like to now invite Priya, who will present her study on the correlation between psychotherapy and psychopharmacology in the treatment of bipolar disorder. Also, I'd like to request if anyone whose mic is muted, thank you so much. I think it's Tripti. All right. All right, thank you. Okay, so the cause of extreme fluctuations in a person's mood, energy, and ability to function. In ICD, we see that F31 refers to the bipolar disorder, a mental health condition characterized by the extreme mood swings to the emotional highs and the lows, as we see a roller coaster of the emotions. Can we go for the next slide? Okay, so there are types of bipolar disorders. That is bipolar 1, in which we have to go for one episode of mania at least and one episode for the depression. In bipolar 2, we go for the one episode of depression, and there is one episode. There not should be the psychosis or the mania. Next slide, please. Okay, so we talk about कि psychotherapy हमारे treatment में कैसे in a particular case which I am representing, which हमने यूज किया है और इंटरपर्सनल सोशल रिदम थेरेपी यूज की है. इसके पेशेंट को ट्रेन किया है कि वो अपने कॉग्निटिव इम्पेयरमेंट्स जहाँ पर हमें देखने को मिले वहाँ पर काम कर सके. उनकी प्रॉब्लम सॉल्विंग टेक्निक्स के ऊपर हमने काम किया है. ट्रीटमेंट के लिए प्रोवाइड कराई है. So can we go for the next slide? Okay, तो साइकोथेरेपी और जो हमारे फार्मास्यूटिकल इंटरवेंशन है वो एक साथ काम कैसे करते हैं, क्योंकि हम मेजरली
ध्यान देते हैं हमने मेडिकेशंस ली लेकिन हम अपने इमोशंस पे या फीलिंग्स पे काम नहीं करते हैं। तो यहाँ पर हमने दोनों को कंबाइन किया है जिससे हमें और ज़्यादा बेटर देखने को मिले। साइकोथेरेपी किसी भी इंडिविजुअल को हेल्प करती है ताकि उसकी कॉग्निटिव स्किल्स जो है उसको इम्प्रूव किया जाए, जो मेल फंक्शनिंग थॉट्स आ रहे हैं उनको ऑल्टर किया जाए, साथ में हमारी जो मेडिकेशंस होती हैं वो हमारे जो न्यूरोट्रांसमीटर में जो केमिकल्स रिलीज होते हैं उनको ओके मेथड हमने क्लिनिकल इंटरव्यूज लिए हैं, साथ में हमने फार्मास्यूटिकल इंटरवेंशन भी यूज की है और साइकोलॉजिकल इंटरवेंशन भी यूज किए हैं। अभी हम यहाँ पर एक केस देख रहे हैं जिसके अंदर 46 ईयर ओल्ड मेल है कि काफी ज्यादा स्पिरिचुअलिटी go for the video. Conclusion? Okay. It's okay. Phase में I had start working on this case 4 months ago. तो उसके अंदर हमने जो मेडिकेशंस देखी थी सोडियम वेलपोरेट, लिथियम कार्बोनेट, ओलिंजापिन, साइकोथेरेपी से हमने सीबीटी यूज किया था, डीबीटी और साइकोएजुकेशन यूज किया था। हमारा मेन फोकस था जो नेगेटिव थॉट्स आ रहे हैं, जो कंडीशन है उसको थेरेपीज और मेडिसिन को कंबाइन करके उनके अंदर इसके अंदर फैमिली का इन्वॉल्वमेंट कराया जिसके बेसिस पर जो हमें रिजल्ट देखने को मिले कि 4 महीने के अंदर अंदर उनके अंदर काफी ज्यादा अपनी इलनेस को लेकर अभी उनको वो सारी चीजें नहीं हो रही थी। ही इज स्टिल अंडर द ऑब्जर्वेशन एंड वी कैन सी द रिड्यूस्ड रिजल्ट ऑफ द psychological interventions as we use IMRS and the BPRS. Can we go for the conclusion, ma'am? ओके टू सम जो हमने रिसर्च देखे उसके अंदर जो चेंजेस देखने को मिल रहे थे कि उनकी बिहेवियर फंक्शन अभी काफी ज्यादा इम्प्रूव हो चुकी है क्योंकि अभी सिर्फ मेडिकेशन के साथ साथ हमने उनके बिहेवियरल चीजों पर भी काम करना शुरू किया है। नाउ ही इज एबल टू इम्प्रूव द कोपिंग मैकेनिज्म, इंटरपर्सनल रिलेशनशिप्स उनकी काफी ज्यादा बेटर हो चुकी हैं, इमोशंस को रेगुलेट करना भी वो सीख गए हैं क्योंकि जब वो स्टार्टिंग में आए थे तो वो मैनिक कंडीशन में थे जिसमें काफी ज्यादा बिहेवियरल और इंटरपर्सनल क्लैशेस भी देखे जा सकते थे देखने को मिले हैं। सो थैंक यू सो मच, दैट्स ऑल।
Thank you so much, Priya. Is Nuzhat here? Has she joined online? All right. Meanwhile, let's invite Ravneet here. Our next speaker is Ravneet, who will present a paper titled Intergenerational Trauma in Narcissistic Personality Disorder, Consequences and Remedial Treatment Through Subconscious Energy Healing Therapy. Please come.
Good afternoon, everyone. Am I audible to online audience? Can I have a confirmation from the online audience? Am I audible?
Yes, you are.
Okay, thank you so much. Good afternoon once again. I am here to present a paper on, the presentation on intergenerational trauma in the narcissistic personality disorder, I will look through a broader lens of intergenerational trauma. So next slide, please. Instead of viewing NPT as a personality flaw, I would be actually looking at it as a family system's defense against inherited emotional survival pattern passed from one generation to the next. My approach, called subconscious energy healing therapy, SEHAT, integrates psychology, hypnotherapy, energy work, and address the deeper roots of narcissism. Next slide, please. Many of the individuals with narcissistic traits come from the families where emotional needs were never met. A parent's perfectionism or emotional detachment becomes a child's coping mechanism, and then the pattern is replayed in the adulthood. So narcissism is not born in isolation. It is inherited pain disguised as self-protection. Healing must therefore reach the beyond behavior and cognition into the subconscious energetic layers that sustains these inherited defenses. Can we move on to the next slide, please? There are many empirical evidences. It has been researched. There's various research papers are also there that proves that. Some of them are written by Rachel Yoda, which demonstrates that developmental neuroscience and trauma research that trauma's effects are multidimensional. And the changes that come in the genes also are epigenetic, and they are also along with the somatic symptoms. Children of the traumatized and emotionally unavailable parents often internalize this distorted sense of self, which is a blueprint of perfectionism, fear of vulnerability, and chronic shame. Another point of view is, by a Bovian viewpoint, the narcissistic individual is not merely a patient, but rather a participant in the system. The narcissistic pattern becomes a form of unconscious loyalty to the family pathology, reenacting the repressed emotional script of previous generations. In a sense, NPT is both an epigenetic and systematic inheritance, a biopsychosocial echo of ancestral pain. I would like to point out, with the quote from Gevermate, trauma is not just what happens to you, but what happens in you, carried across time. Next slide, please. Traditional psychodynamic view locates trauma in the unconscious mind. But energy psychology suggests trauma also leaves imprints in the body's energy system. From the psychodynamic viewpoint, NPT defends against unrepairable internal states like paranoid and narcissistic defenses, dissocial and impulsive traits, dependent and avoidant patterns. Each defense has an energy coordinate. The chronic shame constricts the solar plexus area, which is for self-worth and control. Fear compresses the root chakra, which is for safety and grounding. And the block, grief and empathy, closes the heart chakra that will not allow you to have a real lifetime, real compassion for others and connect with others. These emotional signals stagnate gradients, particularly in the heart, stomach, and lung channel, mirroring the body efforts to contain unprocessed emotion. Trauma, therefore, is not confined to the psyche. It is also encoded in the energetic architecture of the body. Moving on to the next slide, please. My model, subconscious energy healing therapy, SEHAT, it's a holistic model. It unites the clinical psychology, hypnotherapy, vibrational energy work into one cohesive model. It aims to delete inherited emotional scripts, restore self-compassion, and rebuild authentic relational capacity. SEHAT integrates empirical insight with energetic recalibration, acknowledging that trauma resides in both mind and body. Go to the next slide, please. So there are 5 phases of it: subconscious mapping, energetic diagnostic, deep trance healing, reprogramming, integration with breathwork, journaling, grounding to stabilize a new state. Breathwork is crucial because rhythmic breathing actually activates the vagus nerve, the main nerve of parasympathetic nervous system, harmonizing the root and solar plexus chakras and promoting parasympathetic balance. Moving on to the next slide, please. The benefits of this therapy is that when we did the examination for them, For the clients, they exhibit reduced emotional reactivity, lower shame, and greater empathy. They describe lightness, mental clarity, and ease in connection, evidence of both psychological and energetic integration. Empirical evaluation can be done through IPD, MMPI, PANAS test, and NPI test, which will measure all these parameters, how they have actually reduced within a person, within the client. Please, next slide, please. Sehat bridges the gap between the traditional psychotherapy and healing. It adds energetic depth to cognitive psychodynamic models and with the empirical grounding to spiritual approaches. The result is multidimensional, ethically grounded, and clinically transformative framework for addressing complex personality patterns like NPD. Next slide, please. In the end, I would like to conclude with this, that NPD is both a psychological defense and an energetic inheritance, a distortion rooted in intergenerational trauma. Sehat offers a holistic pathway for healing, integrating cognitive, emotional, subconscious, and energetic layers. Future work should include controlled clinical studies, HRV mapping, and psychometric follow-up to empirically validate findings. Ultimate goal is not to replace the psychotherapy, but to expand it to heal the mind, energy, and the lineage together. And I will conclude with the line from Gebermate again, healing is not becoming new, but remembering wholeness. Thank you so much. Yes, thank you, ma'am. Thank you, sir. It's yours. You can.
Thank you. Is Nuzhat ready? Can you please confirm if you're
Yeah, ma'am.
ready?
Good evening. Yeah, I'm ready here.
All
Am
right.
I audible?
This is Nuzhat is joining for the last online presentation, and then we only have a workshop. Can you please mute yourself? Thank you. This is going to be the last online presentation. After that, we only have one workshop and then closing statements, and then we're done for the day. So just please have a little bit of more patience, guys. We invite Nuzhat Begum now, who's joining us online to present on narcissism and emotional distress in gamers and streamers, a study among university students using DAS, NPPT, PGI, and IPD. Please take over, Nuzhat.
Thank you, ma'am. Would you like to share the presentation, or do you want me to share my screen?
Please.
Do you want me to share my screen?
Yes, that would be great. Thank you.
Okay, thank you so much. Am I audible? And the the screen is shared.
Nuzhat, can you hear me?
Yeah.
Since you just joined right now, I'm just letting you, informing you that we only have 5 more minutes left to finish and wind up the presentation. So I just request you to hurry up just a little bit. Is that okay?
Yeah, sure. I'll not take more than 5 minutes.
Wonderful.
Thank you so much. Okay. So my title of the paper is already said by ma'am, and then I'm here under Dr. Amita Puri ma'am. She's my guide, inspiration, everything. Thank you so much for everyone to give me a wonderful opportunity to present the paper here. I'm from West IU University. I'm a PhD scholar working in United States as a special education teacher in high school. And I'm working on university students on my thesis as well. And I have certain gaps to find out from that thesis only. And I'm presenting the paper on narcissism. So this is moreover, the paper is among the university students, those who are online gaming and streaming. They have not only become only popular pastime, but also for like avenues like social recognition, performance. So this particular study is among the 200 university students, and my goal is to just inform interventions for at-risk students. And my objectives are like to measure the level of depression, anxiety, and stress during DAS 21, and then to assess the type of narcissistic traits among these gamers and streamers, and to also to examine their relationship with narcissistic traits using PGI, and also to focus on narcissistic personality disorder by using IPDE. So to compare all this and emotional distress profile between them, gamers and streamers. So also the study is the purpose to fill the gap by examining the relationship between narcissistic traits and emotional distress. Uh, and my research questions are like uh, how narcissistic traits correlate with emotional distress, depression, anxiety, stress, and then also significant differences in gamers and streamers, and how they are associated with high narcissism in digital performance. And also, more streamers will exhibit more subclinical narcissistic personality disorder traits than IPDE than gamers. So these are my hypotheses, which will like score uh, streamers will score higher on the narcissism and PPT than gamers. And then the next hypothesis is vulnerable narcissism will be more prevalent among gamers and streamers, and higher narcissistic traits will positively correlate with emotional distress using DAS. And then also participants with high narcissism, they will show elevated impulsivity and emotional instability. And streamers will be more likely to meet subclinical criteria on narcissistic personality disorder. So these are my uh, standardized tools which I applied for this study, and PPT, DAS 21, PGI, and IPDE, which relates to all my study. And then this is the literature review, which I studied about like narcissistic traits were more like in on social networking. It was already like mentioned earlier also that they often experience heightened and social anxiety, narcissistic tendencies. The studies had been done already 2012, 2017, 2015, and as well as 2008 also. And my methodology is like 50% gamers and 50% students, steamers with gender balanced. And research tools are uh, among these research tools, I'm like trying to record the personality disorder, distress, Lowy bond. They have invented by this, and especially NPPT. This tool is prepared by Dr. Amita Puri, and this is my data raw score. And I'm not taking much time and just getting back to result and conclusion. So steamers will score higher, significantly higher on NPPT, grandiosity subscale than gamers. And gamers also show narcissism, but higher vulnerability score. And then emotional distress will be positively correlated with DAS, anxiety. And vulnerable narcissistic reported higher depression scores than grandiose narcissistics. And personality traits elevated impulsivity, low regrettableness, and high emotional instability. And also personality disorder screening, 80% of the participants met subclinical criteria, and steamers are twice likely as gamers to meet this criteria. And my limitations are uh, this study is just limited to the university students, and these findings may not be generalized to older or non-student population. And future studies also can be conduct longitudinal studies to track these changes in narcissism and distress over time. And also they can explore about the differences in narcissistic expression among digital performers. And also it can investigate the impact of audience size, platform, and monetization on narcissistic traits. And this program also for students in sports and streaming to manage the stress and self-management. And the recommendations of my study are like they can for universities and counseling centers, they can develop mental health workshops tailored to students involved in sports streaming and digital content creation. And for educators and program designers, they can like identify mental health literacy in sports media studies and communication curricula. And also for future researchers, they can investigate intervention strategies, mindfulness, CBT, and digital detox to support all the students with those who are with high narcissistic traits. And these are my references of the paper. With this, I'll conclude. These are publications. Thank you so much, Amita ma'am, to give me such a wonderful opportunity.
Thank you so much, Nazat. All right. Last but not the least, we have Purnima Bamil and Tanya Singh, who are holding a workshop titled Repairing Rifts, Building Connection, Calm the Storm, Self-Soothing Re-Entry, and Real Repair. Please come.
Hello everyone. We are already running very late. So we will be conducting this short workshop, I will say right now. I hope you all will take some of the giveaways from this. So okay. So if we talk about conflict, so every relationship, no matter how healthy it is, will experience some kind of disagreements or emotional tension. So the key message from this is that conflict doesn't mean that relationship is broken. So what matter is how we handle the conflicts, whether it leads to growth, whether it lead to growth or disconnection. So when emotions are high, so our body goes to flight and fight a response. So in that state we can't listen or empathize like our partner, or we can think rationally. So conflict is normal, so repair begins. Repair begins when both people take responsibility, to calm down, understand each other, and reconnect with empathy. So today, I will be taking 7 principles. Next slide. Yes. So today we will be talking about 7 principles for making marriage work. It was developed by Dr. Gottman. You all can follow him. I follow him a lot. So you all can follow him. So yes, so he's working more than 40 years on this topic. So you all can follow him. Okay. So first is enhance your love maps. So basically know your partner, their world, their dislikes, or maybe sometimes they can feel emotionally weak, or they want to share something. It is very important for the partners to work in their partner's parallel world, basically, because life is very long, it's a very long journey. So it is very important to work parallelly with your partner in terms of everything. So yes, why it matters, when partners are familiar with each other, their inner world, they feel emotionally connected and secure. So second point is nurture your fondness and you can read this you already know that we should respect everything, respect boundaries, or we should give respect in every terms to our partner. So basically why it matters, positive thoughts and feeling about each other protect the relationship when there are conflicts, because positive thought, there will be so many positive thought for our partner. So when conflict will come, there will be less negativity, so they will focus more on in connections, basically. So whether they can express gratitude, or for example they can appreciate how you handle the situation very well. Small gesture or nurturing is very important in the relationship. So third point is turn toward each other instead of away. बेसिकली क्या होता है कि पार्टनर्स बहुत ज्यादा एनर्जी लगा देते हैं दूर जाने में, इग्नोर करेंगे, या फिर जिस टाइम कम्युनिकेशन का टाइम होगा तो उस रूम में भी बैठ के दे विल ट्राई टू गो अवे, पार्ट अवे. बेसिकली क्या होना चाहिए कि ठीक है, देयर शुड बी सम स्पेस. Every partner, they have different pattern to deal conflicts. Okay, so there is also research has been like shown, like girls, like women, they have different pattern to deal with conflict. Like they want to solve the problem right now, but the men, they have they have this pattern. They want some space. Uh, but at the same time, the different part, the partner, they can feel कि ये मुझसे बात नहीं करना चाहता है, या फिर जिस टाइम मुझे इमोशनली अवेलेबल होना चाहिए ये नहीं है, वहां पे डिफरेंसेस देखने को मिल सकते हैं. बट एट द सेम टाइम दोनों पार्टनर्स को दोनों के पैटर्न्स को एक बार ही देखना चाहिए. So basically turn towards each other instead of away. We should respond positively, like to our partner, like small bits of attention or affection or like support. Now, fourth point. So let your partner influence you. It is very important. There should be no like. There is a tendency of like one partner. If some partner is like very good in something. So the other partner might have some suggestion for that, but maybe the partner will say, no, this should be done in my way. But this is the little bit wrong way of dealing things in the relationship. So basically, we should always like let our partner like influence each other. So there will be mutual respect and shared decision making. It will strengthen the relationship and the bond. So fifth point is solve your solvable problems. So basically, Gottman said there are two types of problems. There are solvable and perpetual. So solvable are problems which are the situational problems basically, जो कि उसी टाइम की या फिर आज की कोई प्रॉब्लम हो सकती है जो सॉल्व करी जा सकती है. और परपेचुअल हो सकती है, मे बी पर्सनालिटी की वजह से, मे बी रिलीजियस वाइज भी हो सकती है. सो रिलेशनशिप को थोड़ा सा स्ट्रेंथन अप करने के लिए जो सॉल्वेबल प्रॉब्लम्स है उनको पहले सॉल्व करना चाहिए, जिसकी वजह से कनेक्शन थोड़ा जो बॉन्ड है, जो रूट्स है, वो धीरे धीरे स्ट्रॉन्ग होने लग जाएगी. सो हियर द सिक्स्थ पॉइंट कम्स लाइक वेरी इंपॉर्टेंट, द ओवरलॉक ग्रिडलॉक. तो द परपेचुअल जो प्रॉब्लम्स हैं, कोई जरूरी नहीं है रिलेशनशिप में हर चीज को सॉल्व करना. कोई जरूरी नहीं है कि अगर सपोज आपके पास कपल्स भी आए और कोई जरूरी नहीं है कि हमको उनका मुद्दा हमको सॉल्व करना ही है. सपोज हो सकता है कि वाइफ कोई प्रॉब्लम बोले और हस्बैंड बोले, तो जरूरी नहीं है कि हमको उसको सॉल्व करना है. इट इज वेरी इंपॉर्टेंट टू अंडरस्टैंड. सो लास्ट इज द क्रिएट शेयर मीनिंग. It is very important because shared purpose gives depth of the relationship beyond like daily routine. So now Tanya will take over.
So here in the world, we have a lot of NPDs, right? We have heard from morning. We are just learning what NPD means, how do they look, but what next after the diagnosis, right? We got to live with them, like as we have learned in the morning, like they are very charming in their professional career and with the colleagues, and in social life they're really good. But in the personal life, they are, you know, their relations are destroyed. Then how can someone, understand if this particular person belongs to, or not belongs would be the wrong word, but if this person is NPD or not? This is difficult to understand. So as we have also, we also have some tests wherein we learn like, okay, then only we get the diagnosis. So that diagnosis is only available with the psychologist, not with the everybody, right? So how we are going to go ahead and deal with it? Because in normal world, I can be NPD, she can be in NPD, right? And everybody can be. Everybody has some minute or mild symptoms of it. So how we are going to go ahead and live in it without triggering someone else, right? So there are four horsemen and their antidotes. So to make it better understand, recognizing and reversing destructive communication. Because in NPDs, what happens? The communication is destructive, and and the root cause for NPD is they have been bullied in their past, they have trauma, right? All these things are there. So that how we communicate is going to trigger, and how they are going to respond or reciprocate to us is going to decide, right? According to our conversation, first delivery of speech. So first is criticism.
So what is criticism? It means expression, disapproval, or judgment about someone's behavior, work, or ideas. It can be helpful or hurtful, depending on how it has been delivered first. For example, here it says attacks, like criticism is always, taken in a way wherein someone is attacking. For example, if you're at work and your manager doesn't like your project or PPT, so he'll just call you up and say, "ये क्या बना दिया है? What is this? तुम्हें ये काम करना नहीं आता?" This is criticism, right? This is not how one should be given. Criticism has to be constructive, one positive, one negative, and then again positive. Start with a positive note, end with a positive note, and it is called a sandwich method that we use, right? So that you convey what you wanted to, and you don't make someone else feel bad about it. So that's why we call it sandwich. Two positives, and in the middle, one is negative. So you never, these things started like that. So in these, like you can change a statement from attacking to expressing what it has made you feel about, like expressing feelings need without blame, right? So that is the antidote for the criticism, because criticism is often taken as attacking. So example, I feel unheard when plans change suddenly. Can we discuss it together? So this is one of the examples that you can take if the change in plans happening at the end moment, right? Or let's take the previous example. Okay. So defensiveness. What is defensiveness? Is a reaction people show when they are criticized, blamed, or attacked, even if the other person didn't mean it that way. So uh, it blocks understanding and escalates it instead of solving it. So for that, we can use it in a way like acknowledge even a small part of the issue. And you are right, I was distracted. I'll try to be more attentive. Just be gentle. And then comes stonewalling. First, I'll take stonewalling. What is stonewalling? It is a wall that you create. Boundaries are required, but stonewalling means which is like that you are creating such a strong wall which cannot be broken, on which doesn't have a window even to communicate further, so that other person can, even if the other person is making effort to solve it or resolve whatever, right? But which eventually is taken in a way with the emotional unavailability, because at times what happens, people just take, like as mentioned earlier, like women wants instant resolution, men wants some time to cool down and then think about it. So there can be a mutual way. Just take a break for 20 to 30 minutes, cool down, think about it, and then continue half an hour later. So that's how stonewalling can be avoided, and it can be stopped from understanding or misunderstanding from uh, calling it as emotional unavailability or emotional lack of emotional intelligence. Then comes the contempt, which is which builds because of the other three factors that has been mentioned earlier. When a person is hurt or is in frustration expressed in healthy words, it turns into disrespect and feeling of being better than other person. So express gratitude, respect, and admiration is the antidote for the same. And I appreciate how, the example is, I appreciate how you handled that situation calmly instead of taunting in a way like sarcasm, mockery, or the superiority, like I'm senior, you have to just do it that way. So these are the effective communication ways that how we can go ahead. Next slide, please. So all other are just the examples, like repair. Next. More. Yeah. So there are some certain examples that we have, like तू कभी मेरी feelings नहीं समझता, थोड़ा बुरा लगा जब तूने मेरा stand नहीं लिया. These can be the alternative statements that could have been used. मैं ही सब काम करती रहूं, तुझे कोई फर्क नहीं पड़ता. आज थोड़ा सा गया हूं, तू कर दे आज का काम. That would be great. So these are some examples, and like बस फोन ही पकड़ के बैठा रहता है, कुछ पढ़ाई नहीं कर लिया कर. But the intention behind is that the person is caring about it. So you need to express what is the intention. Right? Because first statement is tone, and another one is मुझे थोड़ा टेंशन होता है जब तू ज़्यादा फोन यूज करता है, चल डिनर के बाद वॉक पे चलते हैं. So that is the clear intention that you had in your mind,
and you have communicated in a right way instead of taunting. So that's how I would like to conclude it. Yeah. So effective communication can be one of the way, because we cannot just exclude the NPDs. We cannot just, disown them. We have got to live with them. So how we can survive, or how we can, live peacefully and make them happy as well, because they are also humans. That's why we are psychologists, right? We cannot have the prejudice in our minds or the perceptions. Thank you. Thank you, everybody. This brings us to the close of the event. I'd like to thank everyone who's joined us online and helped us create this wonderful event today. All right, we have a message from our psychiatrist, Dr. Brahmadeep Sindhu, as well. Can we please play it?
All the team members, all the new on. And I first of all like to appreciate the initiative taken of having a full-fledged conference on NPD. We all know that NPD is a disorder which often gets undiagnosed, and the patient doesn't come, and who comes to us is the caregiver. Caregiver is suffering and they are coming to us. So having better knowledge about NPD is going to help us, and the delegates, I'm sure they would be more learned once they participate in this conference. And my best wishes for this conference.
Thank you so much. Once again, I'd just like to thank everyone for joining us online, and all the e-certificates, all the certificates for participation will be provided online after and we'll send the hard copies as well. I'd like to just invite Dr. Swati Sindhu now for the vote of thanks and closing ceremony. She's an accomplished physician and the director of Citizen Hospital and De-Addiction Center. With over 2 decades of clinical experience, she has dedicated her career to holistic patient care and advancement of community health. She's a certified de-addiction specialist from NIMHANS, Bangalore, and has made a significant contribution in the field of addiction medicine and general practice, combining compassion with evidence-based treatment. Her leadership at Citizen Hospital has established it as a center known for both clinical excellence and ethical and patient-centered care. Can we please all invite Dr. Sindhu for the round of applause?
गौरव वोट ऑफ थैंक्स वाला लगा देना स्टाफ आ गया सब लाइट ऑन कर सकते हैं अब तो हाँ सारी लाइट्स ऑन कर सकते हैं हाँ सारी ऑन कर सकते हैं गौरव वोट ऑफ थैंक्स वाला वो लगा देना बस एक स्क्रीन में सारी लाइट्स ऑन कर लो बस ये रहने दो वी आर स्किपिंग दिस लेक्चर बिकॉज आई थिंक एनफ फॉर टुडे कैन एवरीवन सेटल डाउन प्लीज so I have made a short of slide so that I don't miss anyone's name. Can everyone settle, please? Shrishti. So मैं अपना हिंदी में बोलती हूँ. So कैसे धन्यवाद करें आपका अल्फाज नहीं मिलते जिंदगी इतनी खूबसूरत ना होती अगर आप सब हमें ना मिलते आज का प्रोग्राम मुझे लगता है सबने एंजॉय करा होगा और काफी कुछ सीखा भी होगा। थोड़ा टाइम का हमें कंस्ट्रेंट था तो इसलिए हमने थोड़ा जल्दी जल्दी कर दिया। आगे से हम 2 दिन की कॉन्फ्रेंस करेंगे। So I will start with our guest of honor, chief guest, our friends and our esteemed teachers, Dr. Vikas and Dr. Amita Devnani. इन्होंने अपना बहुत ही कीमती समय लेके हमारे पास आए हैं और बहुत ही अच्छे से, पेशेंस से, सुकून से, बहुत ही विकास सर ने तो बहुत अच्छा पढ़ाया है। मैंने सर पहली बार सर का लेक्चर सुना है, उससे मुझे पता चल गया इज अ वेरी ग्रेट टीचर। डॉक्टर अमिता का मैं सुनती रहती हूँ। डॉक्टर अमिता को मैं तभी जाना जब मैंने डॉक्टर अमिता पुरी का पॉडकास्ट सुना। तो मैंने तब से उनसे जानकारी शुरू हुई थी। ओके हाँ। अच्छा, और मुझे 10 दिन पहले ही पता चला कि खुशबू उनकी की वो मम्मी है। खुशबू को मैं 2 साल से जानती हूँ, लेकिन मुझे बहुत बाद में पता चला कि आप खुशबू की मदर हैं। मैं आपका दोनों का तहे दिल से शुक्रिया करती हूँ कि आपने बहुत ही सुकून से और बहुत ही पेशेंस से, बहुत ही हैप्पीनेस से हमारा कॉन्फ्रेंस को अटेंड किया। थैंक यू फॉर दैट। इसीलिए मैंने स्लाइड बनाई थी कि मैं किसी को मिस कर दूंगी। नहीं, नो आई डोंट वांट दिस। मेरे वाली स्लाइड चला दो बस वो।
Yeah. Yeah, this one.
ओके, देन डॉक्टर अमिता पुरी एंड डॉक्टर अमिता पुरी की एक कॉन्जॉइंट टीम है हमारी टीम की तरह। रविंदर सर शायद चले गए हैं और सृष्टि और बेंजामिन भी चला गया है। तो आई एम थैंकफुल टू each one of you for always being there as a part of citizen family, always here and always supporting the interns here। और हमेशा मैम की फाइनल ओपिनियन होती है कि इंटर्न्स के साथ क्या करना है। तो शी हैज गिवन मी फ्री हैंड कि इंटर्न्स के साथ क्या करना है, उनको कैसे सिखाना है पकड़ पकड़ के। तो इसलिए आई होप और भी लोग हमारे इंटर्न्स हमारे साथ जुड़े और अच्छे से सीख के जाएं और मैम से भी गाइडेंस लेते रहें। सृष्टि तो है ही हमारी सबसे अच्छी। कहाँ पे है सृष्टि? नहीं आ रही है, वो आ गई है। सृष्टि की ट्रेनिंग अभी तक चल रही है, 5 साल हो गए हैं। सृष्टि बहुत आगे बढ़ चुकी है एंड आई एम रियली प्राउड ऑफ सृष्टि। तो सृष्टि का बहुत ही अच्छा रहता है और शी इज अ वेरी हैप्पी गर्ल। थोड़ा सा उसको हैप्पीनेस को बस कम करना है, हमें यही है हमें। बट शी इज अ वेरी मोटिवेटेड गर्ल एंड very much into academics and I'm really proud of her and that she is doing very very good। उसके बाद आते हैं हमारे एजू हब की टीम, जो कि हमारी फैमिली की नई टीम है। कमल सर, अंकुश, गौरव, लवली का मैं शायद नाम लिखना भूल गई, सॉरी है। लवली है भी नहीं, चलो अच्छा है, इज नॉट हियर। हाँ ठीक है, लवली को भी थैंक यू है, वो सुन रहा होगा ऑनलाइन। तो आई थिंक आपकी सर का टीम का कोई मिस नहीं हुआ है। हाँ हनी तो हम बहुत वरीड थे कि कैसे माइक अरेंज होगा, कैसे लाइट अरेंज होगा, कैसे इंटरनेट होगा। तो विद इन 1 वीक की ड्यूरेशन में ही हमने, और आई थिंक जो लॉजिस्टिक्स है हमारे लाइटिंग और सारा ऑनलाइन मैनेजमेंट बहुत ही अच्छे से कमल सर की टीम ने किया है विदाउट एनी ग्लिच। सारा कॉन्फ्रेंस का आई थिंक अराउंड 5 to 6 आवर्स की स्ट्रीमिंग बिल्कुल अच्छे से चली है विदाउट एनी ग्लिच। तो आई एम वेरी प्राउड ऑफ यू। और वैसे भी अपार्ट फ्रॉम कॉन्फ्रेंस दे आर ऑलवेज रिसेप्टिव टू एनी फीडबैक, रिसेप्टिव टू एनी डिसीजन। मतलब कोई भी इनको बोला कि नहीं ऐसे करो, so they are always ready for any कि नहीं ऐसे करना चाहिए। and I'm really proud कि they are also now part of our team and will do wonders when we are together। okay, उसके बाद हमारी जो नए इंटर्न्स हैं, मैंने हमारे लास्ट प्रोग्राम में भी आई रियली अप्रिशिएटेड प्रिया, कनुप्रिया, पार्थ, अक्षय। आई थिंक रवनीत मैम का भी नाम मैं भूल गई हूँ, आई एम सॉरी फॉर दैट। तो रवनीत मैम, आप 5 लोग, यू आर रियली मेकिंग अ गुड टीम। बहुत ही अच्छे से आप लोगों ने सारा कॉन्फ्रेंस को मन लगा के टीम वर्क जो डिवाइड किया है, सब में कौन कौन क्या करेगा, दैट वाज अ परफेक्ट एग्जांपल ऑफ अ टीम वर्क, परफेक्ट एग्जांपल। एंड इट वाज अ वेरी वेल ऑर्गेनाइज्ड इवेंट बिकॉज ऑफ ऑल ऑफ यू, बिकॉज ऑफ एवरीवन। तो आप लोग थोड़ा सा पढ़ाई में और मन लगाओ और अच्छे से पढ़ो और यहीं पे ही रहो। आई थिंक मैं अक्षय का भी नाम भूल गई। अक्षय है, पार्थ, रवनीत मैम का नाम रह गया है। ओके, उसके बाद हमने अपने 2 इंटर्न्स को स्पेशली बुलाया, जो कि हमारे वन ऑफ द अर्लीस्ट इंटर्न्स है, पूर्णिमा और तान्या। पूर्णिमा तो आई है आई थिंक हिसार से आई है और तान्या आज जॉब से लीव लेके आई है, सो दैट शी कैन बी पार्ट ऑफ द कॉन्फ्रेंस।
एंड उनका बहुत अच्छा था वर्कशॉप, हमें थोड़ा सा हरिट करना पड़ा उसको, सो उनका वर्कशॉप हम अलग से कराएंगे एक दिन फिर से बुला के। एंड दे आर ऑल्सो वेरी हार्ड वर्किंग गर्ल्स एंड आई रियली अप्रिशिएट ऑल बोथ ऑफ देम। उसके बाद हमारी जो सिटीजन की टीम है, सिस्टर शकुंतला एंड मिथिलेश, आई वांट टू गिव अ बिग हैंड टू देम। So they are named in the last, but they are not the least. They are the best. Sister Shakuntala and Mithesh. तो जो बेसिक जो काम ये रह जाते हैं ना कि किसी ने भी नहीं किया, वो सब ये करते हैं और बाकी सब काम तो करते ही हैं। तो एक छोटी सी पोएम है शिव मंगल सिंह सुमन की, वो लिख के मैं प्रोग्राम को खत्म करते हैं। हमारे बोर्ड्स हैं, वो हमें गिफ्ट कर रहे हैं। सिस्टर आ जाएंगे, सिस्टर के साथ देंगे हम, ठीक है। जिससे पथ पर स्नेह मिला उस राही को धन्यवाद। जीवन अस्थिर अनजाने ही हो जाता पथ पर मेल कहीं। सीमित पगडग लंबी मंजिल तय कर लेना कुछ खेल नहीं। दाएं बाएं सुख दुख चलते सम्मुख चलता पथ का प्रमाद। जिससे पथ पर स्नेह मिला उस राही को धन्यवाद। सांसों पर अवलंबित काया जब चलते चलते चूर हुई। दो स्नेह शब्द मिल गए, मिली नव सफूर्ति, थकावट दूर हुई। पथ के पहचाने छूट गए पर साथ साथ चल रही याद। जिससे पथ पर स्नेह मिला उस राही को धन्यवाद। तो आई थिंक हम अब थोड़ा सा कन्नू और जो हमारी इंटर्न्स की टीम है इंक्लूडिंग सृष्टि, सिस्टर एंड मिथिलेश, आप सब आ जाओ प्लांटर्स देने के लिए। तो सबसे पहले हम विकास सर को देंगे प्लांटर। कन्नू प्लीज ले आओ। आ जाओ सब लोग, सृष्टि आओ, आ जाओ। तो ये बंद कर सकते हैं कि लाइट? गौरव पिक्चर अच्छे से आ जाएगी, प्रोजेक्टर ऑफ कर। इधर भी आ जाओ सब लोग, इधर भी आ सकते हैं। अंकुश पिक्चर कौन ले रहा है? अच्छा ओके सॉरी, आपका नाम नहीं लिया मैंने। ओहो कवरेज। हाँ ठीक है। आ जाओ सब लोग आगे, ठीक है। प्रवनीत मैम, पार्थ, यस प्लीज।
थैंक यू मैम।
थैंक यू सर, थैंक यू
सो मच।
तो आई थिंक अमिता देवनानी मैम प्लीज। सिस्टर मैम आप भी आ जाओ। मैम प्लांटर लेने के लिए दूर खड़ी है कि मुझे तो मिलेगा अब। मैम से दिलवा दो सिस्टर। अक्षय आ जाओ आप भी। सिस्टर ऐसे खड़ा होना, सिस्टर उधर आ जाओ, आप ऐसे आ जाओ, ऐसे हो जाओ। कमल सर की टीम आ जाएगी अब। राना कन्नू, मिथिलेश देना एक प्लांटर और। मैम अंकुश, गौरव, हाँ चलो
हम आपको
नहीं ऐसा नहीं हो रहा है।
नहीं हम आपको
चलो सर यहीं रखते हैं ना हॉस्पिटल में, कोई भी किसी फोटो करानी है अभी तो।
फोटो करानी है, हम आपको ही दे रहे हैं। Saila, please, if you can also come, please join us.
सिस्टर आ जाओ।
हमने आपको
हाँ
दिया
ठीक है। एक और मैम के लिए।
मैम के लिए
हाँ और क्या, रखो भाई, हमें वापस मिल गया। सर विकास सर आ जाओ। खाने के बाद, अच्छा ओके सो हाँ चलो, हाँ यस। और इसके अलावा जो लोग आए हैं जिनकी वजह से प्रोग्राम सक्सेसफुल हुआ है, नाम तो मुझे सबके याद नहीं है। पुष्पेंद्र सर, नाम बताना, लिस्ट देना। पार्थ लिस्ट।
और स्पेशल थैंक्स टू कनु प्रिया also. He has done wonderful job maintaining all that in
In a strict disciplined manner.
Fantastic. Great.
उज्ज्वल बहुत अच्छा एक्सेप्शन एंड डॉक्टर स्वाति ऑलवेज
मुझे तो आप सब लोग ट्रीट पे लेके जा ही रहे हो ना। पिक्चर यहीं पिक्चर बाहर करानी है ना सर, वो रैंप पे, वहां पे चलते हैं। गौरव 1 सेकंड लगेगा, चलो। बाहर है ना उस पे, वहां पे नहीं। हाँ, वो जहाँ बैनर लगाया था अंकुश, हाँ बैनर लगाया ना, चलो वहां चल पड़ते हैं एक बार।
And all those names which have been taken.
पार्क लेके आ गया नाम। पार्क।
Everybody was trying today. सृष्टि का भी thank you.
सृष्टि का तो है ना, बोल रहा था मैंने, इसका नाम बोल रहा है। ओके, सो तान्या इज हियर। तान्या, हाँ ठीक है। रिद्धि, आकृति नॉट है। नेहा,
क्यों कर दो मीटिंग है।
नेहा भी नहीं है। दीपशिखा, अर्नव इज हियर। जिया इज हियर। रजनीश, बेंजामिन हो गया। हरमिंदर, शिवानी चली गई है। ईशा, वो तो पहले पढ़ दिया।
और now we will stand for the national anthem. That's how we always close.